What's going on, world? What's the deal? What up? What up? What up? Hey, y'all, today is Monday, I think. My days kind of just running together. I don't even know what today is. I'm pretty sure today is Monday, but you already know the deal. You already know the deal. Welcome. Hopefully everybody had a good weekend. Your boy's trying to set his camera up right now. You already know the deal. Hey, what's up, man? You already here. Was it Kareem? Appreciate you. You already here, ready? Hey, you already know what we about to do today. Today is Monday. You have to listen. What you mean? What you mean? What happened? You passed. That's what I'm talking about. Look. You're the first one here. You're the first one here. Like, and you mean to tell me you've been sitting there waiting to tell me that you passed your NCLEX? Yo, that's what I'm talking about. Look, you was waiting on me. That's what, bro. Listen, person, Karim, appreciate you. You waited the whole time to tell me that. Listen, congratulations to you. Oh my God, on the fifth time. Look. That's okay, though. That's okay. Damn, I missed the question portion. No, Jamie, we just started. I just got accepted, got my acceptance letter. Shout out to you, Sky. What's up, Carolina? Y'all, hey, so everybody that just jumped in here, Kareem has been waiting for me to get on here to tell us that they passed their NCLEX. So congratulations to you, Kareem. Man, like, that's awesome. That is awesome. Wow. Then I'm early. Yep, Jamie, you are early. You're early. Y'all already know the deal. Once we get 100 folks up in here, you already know the deal. I'm going to turn this thing around. We're going to get it popping. Hey, Black Friday's on its way. For those that don't have the 7-day NCLEX course, that price is going up. Hey, I'm just letting y'all know. And I think I'm going to start streaming every day. Everybody keeps asking me, you should stream every day. You should stream every day. So I think I might start streaming every day because I like doing it. Y'all like being here. Y'all like me being here. Y'all actively participate. I think it's good. I just took my NCLEX yesterday, shut off at 110. Is it Auda? Did I say that? Auda? Hey, come back. Hey, let us know on Wednesday. Let us know on Wednesday what the deal is. What's up, Cindy? What's up, Cindy? Any tips for new nursing students? Study, a small study group. And get ready for time management because you about to get humbled real quick when you get into school. That would be awesome. Yeah, I think I am going to start doing that. Shirts. What about shirts? Oh, everybody wants shirts. You guys want shirts? I can make shirts. I can make shirts and I can actually make some newer shirts. If y'all want shirts, y'all let me know. Smash that like button. Hey, if you guys are new here, welcome. We're about to do NCLEX questions. Once we get 100 folks up in here, you already know the deal. I'm going to turn around. Heck yeah, we want shirts. All right, Sky, I got y'all. Okay. I hear y'all. I will get something up by Wednesday. We'll make some stuff happen. All right, yo, we got 100 people up in here. Welcome. I'm going to turn this camera around. Y'all ain't here to listen to me run my mouth. Y'all here to look at some questions because, y'all are selfish or whatever, but, it's all good. We'll turn this thing around and we'll get it on and popping. All right, here we go. Here we go. Ladies and gentlemen, you guys know the deal. It says, when you say nursing school, you will humble you time management. What do you mean? Oh, you already know. You know what humbling means. All right. Hey, so here we go. We're going to do NCLEX questions, y'all. So welcome. All right. Thank you for the heart. Whoever gave me that. Who gave me that heart? Kareem, appreciate you. Thank you for the heart. Hey, we're going to do NCLEX questions. Hey, participation is the key. I'm kind of funny. I talk kind of fast. There it is. Also, make sure you guys share, follow, give me all of them likes. Hey, that's the trifecta that I need. And that's the trifecta that TikTok needs to make sure we get this stuff out there. Don't be selfish your whole life. Okay. Hey, if you troll my chat or if you rush me at any point in time when I'm doing questions, I promise you I'm going to ban you. Main reason is because I'm petty and I like banning people. All right. I just have this itch to ban you. So don't be that guy or gal. Okay. I'm just letting y'all know. You better tell somebody. Hey, nurseslabs.com is where I got these questions from. Okay. I'm not gatekeeping. I'm just letting y'all know what the deal is. That's where I got them from. Also, 7-day NCLEX course, the 23rd, on Thursday, it's gone. That price is gone for $48. It's going to go up. All right. It's going to go up. I'm letting y'all know right now. Go over there and get it. BruteNurse.com/special. That link is also in my bio. Also, we're going to do an AMA at the end of this. Okay. So here we go. Also, I got to put y'all on a timer because, y'all take too long. Y'all always take forever to answer these questions, but here we go. Question number 1. Nurse John is caring for a client in the outpatient clinic. Which of the following phone calls should the nurse return first? AKA, who do I need to call back first? Who is the most critical that needs my response? Is it a client with Hep A who states my arms and legs are itching? A client with a cast on the right leg who states I have a funny feeling in my right leg? Is it 3, a client with osteomyelitis of the spine who states I am so nauseous that I can't eat? Or is it D, a client with rheumatoid arthritis who states I have trouble sleeping? Which one are we thinking? What are we thinking? Also, if you guys are new here, welcome. I want to know who you are, where you're from, where you guys are at in your nursing journey. Also, if you are not a nurse, what are you doing here? What are you doing here? Let me know who you are, what brings you to the stream. We have equal opportunity love, also equal opportunity hate here, because I will hate you just as much as I love you. Just keeping it in a stack, as the kids say. So, yeah, who are you? What are we doing? You're from Kansas. Okay. Shout out to Kansas. I passed my NCLEX. Milan, you passed your NCLEX. That's what I'm talking. Hey, everybody right now, while you guys are answering, hey, give Milan the love. You already know the deal. Give Milan the love. K-Law says I'm from Maine. Give Milan that love. Hey, congratulations. Welcome to the greatest shit show on earth known as nursing. So shout out to you. Hey, thanks for your review. So the review, tell people about the review right now, Milan. Tell them about the review. Tell them about the review and how it was been. I want your honest feedback right now while there's 400 people in here listening. Here we go. Here's our answer, y'all. Here is our answer in 3, 2, and the answer is B, right? So it is a client with a cast on the right leg who states, I have a funny feeling in my leg, right? That's a neurovascular compromise, requires immediate assessment, aka we're thinking about compartment syndrome, right? So that's part of management of care. Remember, management of care, largest section on the NCLEX. Passed another NCLEX exam today. Nick, that's what I'm talking about. Y'all coming in with the fire today. Let me know y'all are, y'all's success. I love it. That's what I love to hear is y'all being successful, all right? I love to hear that stuff. So congratulations to everybody that's passing. Management of care, first largest section or the largest section on NCLEX at 18 to 23%. All right. It says Bank KB or Bank Baby or Bank Abbey. Obviously, I don't know how to read. I'm ready to take that NCLEX. I bet you are. Here we go. Question number 2. Nurse Sarah is caring for clients on the surgical floor and has just received a report from the previous shift. Which of the following clients should the nurse see first? AKA, who should I see first? Who's going to die if I don't see them first? Think of it like that. ATI is the devil. You right. So is Hesse. All right, here we go. Is it A 35-year-old admitted 3 hours ago with a gunshot wound with a 1.5 centimeter area of dark drainage noted on the dressing? A 43-year-old with a mastectomy 2 days ago. 23 milliliters of serosanguinous fluid noted at the Jackson Pratt drain. A 59-year-old with a collapsed lung due to an accident, no drainage noted in the previous 8 hours. Or is it a 62-year-old who had an abdominal perineal resection 3 days ago, complains of chills? What are we thinking? Hey, also, if you guys are new here, make sure you guys like, share, and follow. All right. Hey, we need 10,000 likes. I just want to let y'all know we got to 1,100 people that were in this live last week. 1,100. We had 67,000 likes. Yo, we got to top that. Make it happen right now. All right. We got people screaming D. Some people screaming C. Science is the devil. Still need to pass that T's. Yeah, you do. Pass that T's. D for infection. Steph, I see you. Katie, thank you for the follow. Is it Katie? Katie? I'm just going to say Katie. Katie seems weird. I may be messing with you, but you know what the deal is. D because of sepsis. Okay. Is it Chima? Thank you for the follow. Linda, thank you for the follow. M, thank you for the follow. All right, y'all. Here we go. Let's check this answer out. It's Katie. Okay, I got you. All right, here we go. Here's our answer, y'all. In 3, 2. And the answer is D, a 62-year-old with an abdominal perineal resection 3 days ago who complains of chills, right? So we're thinking of peritonitis. Right? Should be assessed for further assessment or further symptoms and infection. That is part of management of care. Remember, who do I see first, right? And when you think of ABCs, also think of level of consciousness. That's also part of ABCs, right? An altered mental status could be a breathing issue, also could be a circulation issue. It's an encompassing of all three. So also think about your level of consciousness, okay? All right, collapsed lung though, right? It is a collapsed lung, but what does it say? I don't ever go back, right? But it says he has a collapsed lung, but no drainage over the past 8 hours, right? Over the past 8 hours. Okay. I rarely go back. Because on NCLEX, you don't go back. All right. Once you answer a question, you keep going forward. I went back just to make sure that, hey, that's what that said. Okay. Here we go. Question number 3. Nurse Eve is caring for a client who had a thyroidectomy 12 hours ago for treatment of Graves' disease. What's the other name for Graves' disease? All right. The nurse would be most concerned if which of the following was observed. Is it a blood pressure of 138/82, respiratory rate of 16, or a temperature of 99? A client supports his head and neck when turning his neck to the right. The client spontaneously flexes his wrist with a blood pressure or when the blood pressure is obtained, or the client is drowsy and complains of sore throat. All right. Hyperthyroidism. Okay. All right. So we got some D's, we got some C's out there. What are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions. I got them off nurselabs.com. You guys can go over there and check those out for yourself. They're free. They're a free batch of questions that are over there. Also, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Don't be so selfish in your life, okay? So make sure you guys do that. Calcium problem, it's C, okay. It's Julie, okay. Low calcium, okay. It's D because can't mean what? It can't mean bleeding. Okay. It can mean. But that's what I say. Like, this is why you got to know. This is why pathophysiology and knowing your disease processes is so important. This is why content is important, ladies and gentlemen, when you guys are studying for NCLEX, as well as when you guys are in school. All right. It doesn't go away. What's up, Bella? Here we go, y'all. Read the question again. You telling me to read the question again, or you read the question? Because I'm not reading it again. Here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is C. The client spontaneously flexes his wrist when the blood pressure is obtained. So we think of carpal spasm indicates is part of hypothyroidism, right? So remember, he had a thyroidectomy. They had a thyroidectomy 12 hours ago to treat Graves' disease, right? So Graves' disease is hyper, right? So if we take our thyroid out, we're no longer going to be hyper. We're going to be what? Hypo. That's right. Yeah, that's right. That's right. There you go. So, hey, that's part of physiological adaptation. The third largest section on the NCLEX, 11 to 17%. Okay. Trousseau sign. There you go. I said that because it's not showing. What? Can you not see the question? Because if you let me know, give me a thumbs up if you guys can see the question. I know some people can and some people can't. Can you show the full screen? This is the full screen. This is the full screen of the thing. If I try to do it the other way, it won't look right. So, all right, here we go. Question 4. Julius, it says, my screen can't see while thing, it cut off. Thumbs up. We got some thumbs ups and some thumbs downs. Thumbs ups and some thumbs downs. All right, let's see. How's that? Is that better? Can't see. Let me know if that's better. Better? Okay. Better? Yes. Thumbs up. Y'all leave the live, close the TikTok app and join back in. Okay, I see. That's a little better. Okay, gotcha. Julius is admitted with a complaint of severe pain in the lower right quadrant of the abdomen. To assist with pain relief, the nurse should take which of the following actions? Encourage the client to change positions frequently in the bed, administer Demerol 50 milligrams IM Q4 hours and PRN, apply warmth to the abdomen with a heating pad, or use comfort measures and pillows to position the client. What are we thinking? Hey, if you guys are new here, welcome. Got these questions off nurselabs.com. Why am I always wrong? This is why I fail my HESI. Sarah, this is why you have to practice. And you got to change your mindset, all right? Keep that negativity. Hey, keep that negativity away, right? Least invasive first. There you go. Appendicitis. Okay, so we're talking about appendicitis. What are we looking for then? If that's your answer. Sierra definitely says it's D. Okay. Carolina says it's D. Hey, but like I was saying, hey, if you guys are new here, make sure you guys like, share, and follow. Smash that like button. Hey, we need 10,000 likes, y'all. Hey, we hit tiers around here. 10,000 likes. That's what we need to do. Smash that like button. Get carpal tunnel. I don't care what you got to do. Make it happen. All right. I love y'all. Appreciate y'all. Also, I want to know who you are, where you're from, and where you are at in your nursing journey. How do you decide? You by picking one. Yeah. It says, please stop choosing B. Hey, let people choose what they choose. If they get it wrong, they get it wrong. That's why reading rationales and going through them is so important when you guys are studying, not just with me, but when you guys are doing it by yourselves. All right, here we go. Here's our answer in 3, 2. And the answer is D. Use comfort measures and pillows to position the client. Using comfort measures and pillows to position the client is a non-pharmacological method of pain relief. So just like somebody said earlier, least invasive first. All right. Clients changing positions often can agitate the pain felt by the client. So that's why changing positions often is not good. Right. Demerol. Remember, you can give Demerol, but you want to use the least invasive as much as possible, right? And the client may be experiencing acute appendicitis. Warm compresses can cause rupture of the inflamed appendicitis. Remember, that is part of physiological adaptation, all right? The third largest section on NCLEX, 11 to 17%. If you're a nursing student, hey, this is something that you need to know too. This is something that you need to know and keep yourself familiar with, right? You should do Kahooted. I feel like it's more fun. I don't know what Kahooted is. You got to tell me what that is. All right, here we go. Question number 5. Nurse Tina prepares a client for peritoneal dialysis. Which of the following actions should the nurse take first? So systematically, what is the very first thing that I want to do if I'm going from step 1 to step 4? Okay. Assess for a bruit and a thrill. Warm the diacylate solution. Position the client on the left side or insert a Foley catheter. What are we thinking? Hey, what's going on? Hey, if you guys are new here, we're doing NCLEX questions. I got them off nurseslabs.com. Nurseslabs.com, free sets of questions. Also, if you're a brand new nurse, they do like nursing diagnosis and care plans and all other good jazz over there. I'm telling you, I used them when I was in school like 5 years ago. Trust me, they're definitely still helpful. All right. So make sure you guys like, share, follow, smash that like button. Hey, first goal, we're getting 10,000 likes. The more that y'all smash that like button, the more people we get to. All right. Oh my God, they got care plans. Yes, girl, they got care plans. Where you been? All right, y'all, here we go. Here's our answer, y'all. Here is our answer in 3, 2, and the answer is B. Warm the diacylate solution. Cold diacylate increases discomfort. The solution should be warm to body temperature in a warmer or heating pad. Do not use the microwave. Hey, I'm telling you right now, if somebody had been on the floor, I've seen people throw it in the microwave. Don't do that. All right. Physiological adaptation, third largest section on the NCLEX at 11 to 17%. Okay, 11 to 17%. You guys will hear me start talking about the percentages of what NCLEX will cover, okay? Three largest sections: management of care, pharmacological, parenteral therapies, and physiological adaptation. All right, here we go. Hey, real quick, commercial break. Hey, don't y'all go nowhere. Don't be selfish. Get all this info and then leave, all right? Participate. I'm kind of funny. We're doing NCLEX questions, all right? I got them off nurseslabs.com. It says it right here, nurseslabs.com. I don't gatekeep. That's where I got them from, okay? Also, share, follow. Give me all them likes. We need 10,000 likes. That's where we're going, right? Hey, if you come into my chat and you act a fool, I promise you I'm going to ban that ass. Literally, it says it. I'm going to ban that ass, all right? I'm going to do it, and I'm going to do it forever because I'm petty. And if you guys see anybody acting rude in the chat, hey, just start dropping 600. I'm going to be like, who? We'll pause the chat. I'll ban that ass, and then I'll go on. We'll go on about our day, all right? Also, 7-day NCLEX course. It's going, hey, this price is going away. It's going up to $97 on Friday. I'm letting y'all know that right now, all right? So go over there and get it, $48. You get it for a lifetime, y'all. Y'all get it for a lifetime. Milan, hey, passed her NCLEX, right? And been using the course. So I'm just letting y'all know. Y'all go over there and check it out for yourself, all right? Also, one-on-one tutoring, you guys can check those links out in my bio, okay? And also, we're going to do an Ask Me Anything to follow this, all right? Probably for about a good 30 minutes, whatever questions you guys have, all right? Here we go. Question number 6. Is it Nurse Jana teaches an elderly client with right-sided weakness on how to use a cane? Which of the following behaviors, if demonstrated by the client to the nurse, indicates that the teaching was effective? So what do we do? And the patient is just like, yeah, okay, cool, I got it, Gucci, right? The client holds the cane with his right hand, moves the cane forward, followed by the right leg, and then moves the left leg. The client holds the cane with his right hand, moves the cane forward, followed by his left leg, and then moves the right leg. The client holds the cane in his left hand, moves the cane forward, followed by his right leg, and then moves the left leg. Or the client holds the cane with his left hand, moves the cane forward, followed by his left leg, and then moves the right leg. All right, what are we thinking? Everybody screaming D. We have some D's, we have some C's, we have some A's. What are we thinking? Hey, if you guys are new here, welcome. We're doing nursing questions, NCLEX questions. Got them off nurseslabs.com. You guys can go over there and check those out for yourself. We got 500 plus people. Hey, we were just at peak at like 800 folks up in here. Y'all keep doing what y'all doing. All right. Hey, a little thing about me. I failed my NCLEX, y'all, 3 times. 3. Not once, not twice, but 3 times. And nobody ever knows that unless I openly tell you that. Okay. Who said that they're taking their NCLEX tomorrow? It's Ms. I'm just going to say Ms. I don't know. If you're taking your NCLEX tomorrow, I need for you to get off my live. Get off, because you don't need to be here trying to learn or trying to cram. This is equivalent to cramming. If you're taking your NCLEX tomorrow, go away. And if you go away, there's no need for you to be here because you're cramming right now. And if you don't know it by now, you don't know it at all. I have nothing but full faith in every single one of y'all. Okay. I'm taking my NCLEX tomorrow and I'm anxious. Okay. You being here is going to make you more anxious. So go away or I'm going to ban you and then come back on Wednesday or Friday and let us know that you passed. Okay. Because you doing this is nothing but cramming. All right. I'm just letting you know I'm terrible with the way I'm cramming, learning it the hard way. That's what I'm trying to tell you. And the answer was C, ladies and gentlemen. The client holds the cane with his left hand, moves the cane forward, followed by his right leg, and then moves his left leg. All right. The cane acts as support and aids in weight bearing for the weaker right leg. That is health promotions and maintenance. All right. Health promotions and maintenance. Like I was saying, if you are here and you take your exam tomorrow, go away. Hey, I'm just letting you know, go away. You don't need to be here. You got this. You've prepared for it. You've studied for it. You don't need to be here. Okay, all this is going to do is just make you even more nervous, more anxious, because you're going to possibly start getting questions wrong. All right, don't do that to yourself. Go away. Go watch a movie. Go play a video game. Go do cartwheels in your front yard. Go do something. Just don't fucking be here. Okay, here we go. Question number 7. An elderly client is admitted to the nursing home setting. The client is occasionally confused and her gait is often unsteady. Which of the following actions, if the nurse or if taken by the nurse, is most appropriate? Keyword is most. Other words that are keywords that are in here is that she's occasionally confused and has an unsteady gait. All right. So what comes to mind when I start thinking about somebody who's confused with an unsteady gait? Right. So is it A, ask the woman's family to provide personal items such as photos or mementos, select a room with a bed by the door so the woman can look down the hall, suggest the woman eat her meals in the room with a roommate, or encourage the woman to ambulate in the hall twice a day. What are we thinking? Got risk for fall. So we're thinking a safety issue, right? Possible safety issue, okay? All right. What are we thinking? Hey, by the way, if you guys are in here and you guys are complaining that I talk too much, no part of me cares and go away. Who said bed alarm? Kate said bed alarm and chair alarm. Look, right? Everybody's screaming A. It's Corona time. Is it Luna? Thank you for the follow. Nicole, thank you for the follow. Lindsay, thank you for the follow. Appreciate you. I'm going to say A to keep her from trailing the halls. Okay, Bella. All right. I really don't feel like any of these are the best. Well, hey, you don't feel, it doesn't matter what you feel. Answer it. It doesn't matter if you feel like it's the best based off of what is given to you. What is the best answer? Okay. Samantha says A or C. Samantha, you got to give me one. Give me one. C, so she should be supervised by another. Hey, we'll find out. Here we go. Kat, thank you for the follow. Here we go, y'all. Here's our answer in 3, 2. And the answer is A. Ask the woman's family to provide personal items such as photos or mementos. Photos and mementos provide visual stimulation to reduce sensory deprivation. Physiological adaptation. So this lady is in a nursing home, right? Often confused, right, with an unsteady gait, right? So we're thinking, hey, it's definitely a safety issue, right? So we want to do, oh my God, what is it? It's like, well, we want to distract them, right? Yeah, we want to distract them, keep them focused on things that are, oh, we want to redirect, reorient to redirect. Yeah, Teresa, you got it right. That's what I'm talking about. Kate, I was going to get there. I'm a a little slow. I took a nap, so I'm a little slow, but I appreciate everybody. I appreciate y'all. Hey, we had 11,000 likes. Hey, 20,000 likes, baby. Let's make it happen. Physiological adaptation, y'all. Third largest section on the NCLEX at 11 to 17%, right? 11 to 17%. I appreciate you, Kate. I see you out there. Here we go. Question number 8. Nurse Evangeline teaches an elderly client how to use a standard aluminum walker or aluminium, wherever you're from. Okay. We try to be equal opportunists when we pronounce words around here. Which of the following behaviors, if demonstrated by the client, indicates the nurse's teaching was effective, right? So what did we say that was correct, right? And that the patient absorbed and took with them, right? As in regards to knowledge. The client slowly walks the walker forward 12 inches, then takes small steps forward while leaning on the walker. The client lifts the walker, moves it forward 10 inches, and then takes several small steps forward. The client supports her weight on the walker while advancing it forward, then takes small steps while balancing on the walker. Or the client slides the walker 18 inches forward, then takes small steps while holding onto the walker for balance. What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions. These are free NCLEX questions. I got them off nurseslabs.com. You guys can go over there and check those out for yourself. They also do care plans for all my nursing students that are out there. I'm telling you right now, they are great. They hook it up with the Nandas. Not even playing with you. So if you guys are new here, I want to know who you are, where you're from, where you were at in your nursing journey. But do you always have to be elderly? They don't always have to be elderly, but it's more times than not, right? You from Ohio? I see you out there, Nikki. Hold on, y'all. I got to get somebody at 600. Hold on. Hey, if you guys start seeing people that say, see my following or anything like that, y'all let me know, because that's somebody essentially like trying to sell me their nudes. But why sell nudes, baby, when you can get them for free? I mean, what? Yeah, I said it. No shame. None whatsoever. Here we go. And the answer is B. The client lifts the walker, moves it forward 10 inches, and then takes several small steps forward. All right, I'm from Canada, my second year in my bachelor. Shout out to you. Wyoming. A. Katie, I went to the Devil's Tower, I think it's in Wyoming, right? Hey, I'm not even gonna lie. I think I might move up there if I ever want to hide away from the world. It's nice up there. Hey, health promotions and maintenance, 9 to 12% on the NCLEX. Okay, 9 to 12%. All right. Who said it's unsafe? That seems unsafe. Well, yeah, it does seem unsafe. It does. It says PA done in 6 months. Shout out to you, Kara. Hey, so here's the thing about some of these questions. Sean, are you Sean? Hey, y'all better let Sean know. Y'all better let Sean know. You don't come up in here rushing me. Y'all better not let him do it. So if I give you 100 questions, some of them are just not going to make any sense. All right. But that doesn't negate the fact that you got to go out there and you got to get them wrong. Okay. I got these questions off nurseslabs.com. Okay. Nurseslabs.com is where I got them from. Katie, Annie, thank you for the follows. Appreciate you. And also remember that NCLEX world, book world, school world, different from real world. Okay. So you guys are studying for perfect world. All right. Here we go. Question 9. Nurse Derek is supervising a group of elderly clients in a residential home setting. The nurse knows that the elderly are at greater risk of developing sensory deprivation. For what reason? Is it increased sensitivity to side effects of medication, decreased visual, auditory, and gustatory ability, isolation from their families and familiar surroundings, or decreased musculoskeletal function and mobility? What are we thinking? Remember, what are they at greater risk of developing? Are they at risk for developing all 4 of these? Absolutely. But what is the one that is the most, right? What is the greatest risk? All right. User 36. Appreciate the follow. All right. What are we thinking? Also, if you guys are new here, welcome. We're doing NCLEX questions. Y'all need to smash that like button. Hey, we need to get 20,000 likes. 20,000 likes. That is the goal right now. 20,000 likes. And make sure you guys follow. Send this out to people who may need it. All right. Don't be greedy and selfish your whole life, coming over here, getting knowledge and not sharing with nobody. What the hell do you think this is? All right. Let me give y'all 10 seconds. All right. It's B. Jacob says it's B. B, senses. All right, Jamie, I see you. Not a nursing major, but D. That's okay. Hey, everyone here, everyone who is in different professions is welcome here. All right, I promise you that. All right, except for when you come in here and you start acting a fool, then I'm gonna give you a 600. All right, here we go, y'all. Here's our answer. Here's our answer in 3, 2, and the answer is B. Decreased visual, auditory, and gustatory abilities. Gradual loss of sight, hearing, and taste interferes with normal functioning. Health promotions and maintenance. All right, 9 to 12% on the NCLEX. One of the smaller sections on NCLEX, but still very, very important. You ate that. I mean, all right, Tracy. I don't know if it's edible, but I see what you did there. Oh, you ate that because you got it right. That's what I'm talking about. All right, let me stop. I'm feeling old now just because it took me a long time to get that. I shared you to my bio, major sister. She likes your lives. Shout out to your sister liking my lives, little Hoover. I appreciate you. Y'all keep sharing it, though. You already know what I'm about. I ain't about the games, all right? Here we go. Question 10. A male client with emphysema becomes restless and confused. I wonder why. What steps should Nurse Jasmine take next? Encourage the client to perform pursed lip breathing. Is it check the client's temperature, assess the client's potassium level, or increase the client's oxygen flow rate? How many times a week do you do lives? How many times do you do lives? Why'd you repeat that twice, Miss Green? I do lives 3 times a week, Monday, Wednesday, and Friday, but I think I'm going to start doing them every day. Hey, if you want me to start doing them every day, give me the 30,000 likes. And then give me thumbs up. Steph says A. I got you, Steph. I got you, Miss Green. You good. Yeah, do them every day. Oh, man. If I do them every day, what do I get? What y'all gonna give me? Please do them every day. I say D, thumbs up. Oh, okay. All right. Did you just wait? Who's like? Did you just hear me? Nadine, I didn't hear. I didn't. I didn't hear you. My bad. Here we go, y'all. Yeah, you get more exposure. Yeah, you do get more exposure for sure. Here we go. Here's our answer, y'all. Here's our answer in 3, 2. The joy of helping us, Pat. Look, I am very happy every time I hear somebody tell me that they pass NCLEX. Trust me when I tell you that. I promise. And the answer is A. Encourage the client to perform pursed lip breathing. Pursed lip breathing prevents the collapse of the lung unit and helps the client control the rate and depth of breathing. Hey, some of these won't have rationales and some of them won't actually have the areas, right? And that's okay. Graduate, is it Elise or Alice? Graduate in 20 days. Shout out to you. Increased oxygen can decrease respiratory drive. It sure can. That's what happens with COPD patients. Thanks, Nurse Kevin. I'm going to take the T's. What should I test? Any thoughts? It says, what should I test when you go to take the T's? Like, what T's? I don't know exactly which one. Yeah, I am with COPD patients. Yep. Oxygen is a medication. That's true. Oxygen is a medication. And we'll talk about that later, though. Here we go. Hey, real quick. We're doing NCLEX questions, y'all. I got them off nurseslabs.com. It says it right there, nurseslabs.com. I don't gatekeep. You guys can go over there and check those out for yourself. You guys are really pushing for me to wanting to do this every day. I'm just saying, hey, participate. I'm funny, kind of, sort of. I may not be your cup of tea. Just don't drink me if I'm your cup of tea, because that's weird for you to drink me, and we don't really do tea. Well, yeah, we do. I'm from the South, and we drink nothing but sweet tea. Make sure you guys share, follow. Give me all them likes. Don't be selfish your whole life, all right? If you come into my chat, try to sell me your nudes, which I could get for free. And if you try to come in here acting a fool or rush me, I will ban you. I will ban that ass. And I expect everyone to police one another to make sure that we get on to that, because we're cultivating a good comment section down there. Okay. Also, 7-day NCLEX course, $48 right now. It's going away. Thank you for the rose, India. Appreciate you. Hey, it's going away. It's going up in price. So I'm telling you, you can get an NCLEX review and all of the stuff that's being updated for $48. All right, go over there and check that out. That link is in my bio. Also, if you need tutoring 101, that link is also in my bio. And we're going to do an Ask Me Anything after this. So whatever question you guys got, you guys can hit me with them after we get finished with the questions, okay? Here we go. Question 11. Randy has undergone a kidney transplant. What assessment would prompt Nurse Katrina to suspect organ rejection? Is it sudden weight loss, polyuria, hypertension, or shock? You're a blessing? Girl, you a blessing. Everybody in here a blessing. Megan says hypertension. Oh, Megan said hypertension, y'all. You already know the deal. Gabby says shock. Okay. What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions. Sudden is keyword. There you go. That's in the answer. Hypovolemic shock. Okay. Okay, Gabby, you ain't got to yell at me, girl. I see you. Thank you for the shares. Appreciate the shares. Thank you for the follow. We got D. Is it Andrea? Thank you for the shares. I want to know where everybody is from. I want to know where you're at in your nursing journey. We have people from the Philippines, people from Nepal, South Africa. Hey, I'm waiting for somebody to tell me they're from Antarctica. And I'm just like, oh, okay. See how that works. All right. Here we go, y'all. NY, okay, I see you out there, New York. Ghana, okay, shout out to y'all. Canada, Massachusetts, okay, I know some folks up there. All right, y'all, here we go. Virginia, shout out to VA. Michigan, Florida. I lived in Florida for about a good 4 years. Okay. Arizona, Texas. Destiny, what part of Texas? I live in San Antonio. Here we go. And the answer is, according to Gabby, it's No, Gabby said shock. Megan said hypertension. Nigeria, shout out to Nigeria. All right, hypertension along with fever and tenderness around the grafted kidney reflects acute rejection. From Delaware, you're like the fourth person I've ever met from Delaware. I keep forgetting that Delaware is a state. Not even gonna lie to you. Antarctica, shout out to you. Reduction of risk potential, y'all. The reduction of risk potential. Zoe from Wyoming. Hey, Wyoming is a very pretty state. Like, I'm not even gonna lie to you. If y'all have never been to Wyoming and done like nature stuff, go out there and do it. Just watch out for like all the wild animals, because I don't do wild animals like that. So go during the day. Keep guns. I'm just saying. Reduction of risk potential, all right? 9 to 12% on the NCLEX, okay? Minnesota. Oh, okay, Becky, I see you. Here we go. Question 12. The immediate objective of nursing care for an overweight, mildly hypertensive male client with uteral colic and hematuria is to decrease what? Is it pain, weight, hematuria, or hypertension? Can I show what website? I just told you the website. The website is nurseslabs.com. Which website are you talking about? My website? Is it Yoli or Jolie? Holy? Which one? Thank you. You're welcome. Wait. Okay. What are we thinking? Hey, if you guys are new here, welcome. Hey, we need 30,000 likes. You have no idea? Gabby, you can guess. It's okay. I would rather you guess. You have a 25% chance of getting it right if you completely don't know. You have a 25% chance of getting it right versus just not answering it at all. My website is thebootnurse.com/special. You'll see it pop back up. Also, if you want to go look at that website, it is in my bio. The links are in my bio. The first one says the 7-day NCLEX course. The other one says NCLEX 101 coaching. Okay, here we go, y'all. Here we go. Here's our answer. In 3, 2, and the answer is A, pain. So it's sharp, severe pain radiating towards the genitalia and thigh is caused by urethral distension and smooth muscle spasm. Relief from pain is the priority. Okay, that is the priority. That's what I'm talking about, Becky. You got it right. Pain always, right? When we're talking about these specific things. All right. Hey, so the answer is pain. Hey, here's one of the things that's so important. When you guys are reading your questions, you read your rationales on why it's right, and then you read these on why they are incorrect. You'd be so surprised on how you would find a question 5 or 6 questions down the line that would match that answer that you just went over. Okay. So that's why it's very important that you have your content, you have your questions, your answers, and then you have your rationales that you review. All right. Those are the 3 most important things that you need. There is no tricks here. There are no tricks to studying for NCLEX. It's called putting in the fucking work to do it. I'm just keeping it real. Hey, and if you don't like the fact that I say the F word, welcome to nursing, because the favorite word of a nurse is the F word. I promise you. Here we go. Question 13. Matilda with hyperthyroidism is to receive, Lugol's iodine solution before a subtotal thyroidectomy is performed. The nurse is aware that this medication is given to what? Is it decrease the total basal metabolic rate, maintain the function of the parathyroid glands, block the formation of of thyroxine by the thyroid gland, or decrease the size and wellarity of the thyroid gland? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. Nurseslabs.com is where I got these free sets of questions. You guys can go over there and check those out for yourself. Make sure you guys smash that like button. Make sure you guys like, share, follow. That is what I need. That is what TikTok needs. And in reality, that's what y'all need. Y'all said y'all want me to do this every day. Y'all got to give me 30,000 likes. Y'all got to give me 30,000 likes if y'all want this every day. I'm just letting y'all know. I'm going to give y'all 10 seconds. But I also want to know who you are, where you're from, and where you're at in your nursing journey. Y'all want to be so selfish and not tell me where y'all from. You know what I'm saying? Jesus is king. I've seen you. You've literally answered it the whole time. I see you. Montreal. Okay. 7 months to go. Megan, you're almost there. Washington, Massachusetts, Montreal. We got some Canadians up in here. Just run. Shout out to y'all. You're from Arkansas. Okay. Georgia Peaches. I see y'all. Colorado, Mile High. I see y'all. Charlotte, North Kakalaki. All right. New Orleans, Nolens. Okay, I see y'all. Australia. That's what I'm talking about. Hey, down under. I see. I got some friends that live in Australia. West Virginia. Okay, that's a first. Florida. Shout out. Hey, anybody from Duval? All right, here we go, y'all. Here's our answer in 3, 2. And the answer is D. It is to decrease the size and vascularity of the thyroid gland. Lugol's solution provides iodine, which aids in decreasing the vascularity of the thyroid gland, which limits the risk of hemorrhage when surgery is performed. That is part of pharmacological and parenteral therapies, right? Which is 14 to 18% on the NCLEX. That is the second largest section on the NCLEX exam for both RNs and for both LPNs. All right. LPNs, LVNs, you guys are both the same thing. The name just changes upon location, right? So pharmacological and parenteral therapy, second largest section on the exam. All right. Shout out to y'all. Here we go. Question 14. Ricardo was diagnosed with type 1 diabetes, right? The diabetes, type 1. The nurse is aware that acute hypoglycemia also can develop in the client who is diagnosed with what? Liver disease, hypertension, type 2 diabetes, or hyperthyroidism. User 69, 6 months till you finish school. Shout out to you. It says, are you in Luxor Club in Jax? I am not. No, I am not. Hey, I am not. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurselabs.com. Hey, make sure you guys share. Share. Smash that like button. Hey, we're almost at 30,000 likes. Y'all look like y'all kind of slowing up over there. Y'all look like y'all are slowing up over there. All right. Is it Antwi? Thank you for the follow. Appreciate you. Who said V? V's not even on here, Hannah. What are we doing? Oh, okay. I got you. C. Okay. I got you. Insulin resistant. Okay. Hyperthyroidism. Okay, Jasmine. How often do I do what? Do these happen? How often do what happen? What? You talking about my lives? Hey, if you guys are going to ask me a question, you got to give me a little bit more context. Jessica, Jade, thank you for the follow. Jordan, appreciate the follow or the like. Caitlin, Gina, thank you for the follow. Here we go, y'all. Here's our answer in 3, 2. And the answer is A, liver disease. A client with liver disease has a decreased ability to metabolize carbohydrates because of the decreased ability to form glycogen, right? And to form glucose from glycogen. That is physiological adaptation. Megan, you got 4 to 4, baby. That's what I'm talking about. Mary, don't make that face. Jasmine, don't cry. What y'all doing out here? Come on now. Y'all Gucci out here. This is why it's important to practice. Okay? Hannah said, oh my God, let me go take my NCLEX tomorrow. Hey, go ahead, Hannah, and let us know how you do. All right. A physiological adaptation, third largest section on the NCLEX, 11 to 17%. Okay. This is one of those important sections, right? Hey, 44 to 49% of the NCLEX makes up management of care, pharmacology, and physiological adaptation. Okay. 44 to 49%. So almost half of the entire exam. All right. Question 15, Tracy is receiving combination chemotherapy for treatment of a metastatic Hey, can y'all hear me? I think everybody can hear me. Hold on one second. I don't know what happened. Is it metastatic carcinoma? Sorry. Nurse Ruby should monitor the client for systemic side effect of what? Ascites, nystagmus, leukopenia, or polycythemia. What are we thinking? Everybody screaming C. Everybody screaming C at me. Hey, if you guys are new here, welcome. Hey, if you guys are new here, welcome. We are doing NCLEX questions. Y'all got to 30,000 likes. Baby, keep it going. Y'all already know how we do around here. Keep it going. Welcome. If you guys are new here, we're doing NCLEX questions. Got them off nurselabs.com. Free sets of questions that are over there. If you're a brand new nurse, hey, they got nursing diagnosis, all that stuff. It says, what field you in, my boy? I'm a nurse. I've been a nurse for 3.5 years. I've worked in the ICU, specifically in a burn ICU, a neuro, and a medical ICU. I've worked in the PACU, and as well as I'm an OR nurse currently. I've been in the Navy for 16 years, been deployed twice. I'm a master instructor in the Navy. I'm a trauma nurse instructor. So been doing a whole bunch of things. Very helpful for care plans too, for sure. Hey, PICU nurse right here. Shout out to you, sir. Shout out to you. Do you like the OR? I do. The OR is cool. And the answer is C. Leukopenia, a reduction in white blood cells, is a systematic effect of chemotherapy as a result of the myelosuppression, right? Physiological adaptation. Mish said, Mr. Kevin, question, sir. What is your question? Damn, you just be nursing. Sure. I be nursing, I guess. Nurses be nursing, I guess. You know what I'm saying? But hey, physiological adaptation, 11 to 17% on the NCLEX, ladies and gentlemen. Hey, remember, when people are on chemotherapy, not only do they kill the bad stuff, they kill the good stuff. All right? So think about that. Hey, real quick, commercial break. We're doing NCLEX questions. Got them off nurselabs.com. This is where y'all need to smash that like button. Alana says, psych nurse. Shout out to you. Hey, I can't be a psych nurse because I'll be ready to fight every day. Patients and staff, just because I'll be on high alert. You know what I'm saying? Hey, share, follow, give me all them likes. All right. Hey, 40,000 likes. That's the next goal. We got to make sure that happens. Okay. Don't be selfish your whole life. Make sure you guys share this to people. Share it to folks. Okay. Don't troll my chat. You come into my chat trying to sell me your nudes. You come in here trying to rush me. I promise you I'm gonna ban you. I'm petty. And then when we do a wrap up at the end, I will talk about you and I will laugh. Okay. Nurselabs.com is where I got these questions. That's what I told you guys. 7-day NCLEX course. That is my course that I created. I have one review that's up there right now. The new generation NCLEX review. I've already had a bunch of people come in here and tell me it's useful for them and they passed, y'all. $48. You get an NCLEX course. If you're a brand new nursing student, I'm telling you, the largest flex that you could ever have is saying that you got an NCLEX review for $48. I promise you. I promise you. That price is going away on the 23rd. So Thursday is the last day. So hey, that link is in my bio. Go over there and check it out. Also, if you guys want one-on-one coaching, that link is also in my bio. And we're going to do an Ask Me Anything after this. So you guys can ask me anything related to nursing. Don't be out here trying to be weird, okay? Because I will come at you with a very weird ass response. All right, here we go. Question number 16. Norma, with recent colostomy, expresses concern about the inability to control the passage of gas. Nurse Oliver should suggest that the client plan to what? Eliminate foods high in cellulose, decrease fluid intake at mealtimes, avoid foods that in the past caused flatulence, or adhere to a bland diet prior to social events. What are we thinking? What are we thinking? Hey, I tell nobody to go nowhere and then they leave. There was like 700 people in here. Well, I guess 200 plus of y'all are just like, fuck what you got to say, Kevin. That's all love, though. It's all good, though. If you guys are new here, welcome, welcome, welcome. It's if Megan says C, it's C. Megan's been on a roll, Hannah, like she really has. So everybody just follow Megan. I need to hear every word. You need to hear every word. Hey, if Megan says it's C, y'all, you already know what the deal is. Hey, but don't be following because, hey, not everybody's going to have Megan. You know what I'm saying? When you guys are going there to take your exam. Even though you could think of Megan sitting on your shoulder, whispering your ear the answers. Kind of like Home Dude did off How High. You know what I'm saying? Don't do that. Don't do that. Because, you know what I'm saying? Watch me get it wrong. Megan, I hope you know what? We'll see. Here we go, y'all. Here's our answer. In 3, 2. And the answer is A. Oh, I'm sorry. The answer is C. See, you see how that common mistake, right? That's an A right there. But the answer is C, y'all. The answer is C. Avoid foods that in the past caused flatulence. Foods that bother a person preoperatively will continue to do so after a colostomy, right? Health promotions and maintenance, right? 6 out of 6. Look, I'm just letting y'all know. I'm dyslexic. I read the question wrong. Hey, what is the deal? What is the famous saying? RTFQ, y'all. RTFQ. What is it? Good job, Megan. Shout out to Megan. All right. Megan, you're the teacher's ass now. You're the teacher's assistant. That's a bad question. It could be a bad question. But guess what? You'll get bad questions on NCLEX. Is that going to be your excuse to get it wrong? Probably not. Right? And you will get them wrong. You're not meant to get all the questions right, ladies and gentlemen. You're just meant to get enough right to where you pass. Trust and believe me. All right. That's why you have to make yourself familiar with the content. All right. Sometimes you get bad questions. You just got to deal with it. All right. Question 17. Nurse Ron begins to teach a male client how to perform colostomy irrigation. The nurse would evaluate that the instructions were understood when the client states, I should what? Lie on my left side when instilling the irrigation solution. Keep the irrigating container less than 18 inches above the stoma, and instill a minimum of 1,200 mLs of irrigation solution to stimulate evacuation of the bowel, or insert the irrigating catheter deep into the stoma if cramping occurs during the procedure. Hannah says A. Hannah, I'm guessing that's you guessing, right? Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. Hey, you guys are well on your way to getting another review tomorrow. You guys are well on your way. So, all right, Hannah, I see you. Hey, if you guys are new here, welcome. I want to know who you are, where you're from, where you're at in your nursing journey. All right. Hey, I live in San Antonio. I've been a nurse for 3.5 years. I've been in the Navy for 16 years. I got a little bit of a broad kind of background. Okay. Been an instructor. I was an instructor for a surgical tech program for 3.5 years. Loved it. From Kentucky. Okay. Just graduated on Saturday. Shout out to you, Crystal. Is this for LPN or RN? For both. I just recently passed. Shout out to you, Maria, for passing your NCLEX. Everybody give Maria some love. Let her know. Welcome to the greatest shit show on earth, Wyoming. Okay. All right, y'all, here we go. Here's our answer in 3, 2, and the answer is B. Keep the irrigating container less than 18 inches above the stoma. This height permits the solution to flow slowly with little force so that excessive, peristalsis is not immediately precipitated. That is part of health promotions and maintenance. 9 to 12%, one of the smaller sections on NCLEX, but still very, very much important. Upstate New York. Nikki, you're from Canada? Okay, that's cool. That makes sense. Looking to start in the fall. Okay. Hey, Don't look to start. Make it happen. Hey, I hear people say, I can't wait. Oh, I really want to go to school. Don't want to go to school. Make it happen. Thanks for the review. I'll hop on each day that I can. Shout out to you, Katie. All right. Hey, when you're here, we change up verbiage. All right. There's no I wish. There's no nothing like that. If you want it, you go make it happen. Seeing this at the wrong time, just recently had a license revoked. Jenna, that's unfortunate. Hey, if you want to tell us that story, you can. Here we go. Question 18. Patrick is in the oliguric phase of acute tubular necrosis and is experiencing fluid and electrolyte imbalances. The client is somewhat confused and complains of nausea and muscle weakness. As part of the prescribed therapy to correct this electrolyte imbalance, the nurse would expect what? Administer K-Exolate, restrict foods high in protein, increase oral intake of cheese and milk, or administer large amounts of normal saline via IV. I graduated in 3 weeks. Shout out to you, Crystal. Hannah says D. Okay. Denisha, A or D. Hey, you got to give me one, Denisha. Hey, give me an answer and run with it. Make a choice and run with it. You'll hear, like, a lot of us in the military, we say that, like, sometimes, hey, making a good choice now is better than making a great choice later. Because, some decisions require answers right now and could save lives. And if you think about it on that aspect, when you're taking care of patients, that can go the same exact way. All right. If you guys are new here, welcome. If you guys are new here, welcome. We're doing NCLEX questions. Got them off nurselabs.com. Hey, we're trying to get to 40,000 likes. So make sure you guys like, share, and follow. Like, share, and follow. Also, if you guys are looking for an NCLEX course for $48 and you get it for a lifetime to include all the updates, check out the link in my bio, thebootnerds.com/special. That special is going away on Black Friday. All right, y'all, here we go. Here's our answer in 3, 2, and the answer is A, administer K-Exolate. K-Exolate, a potassium exchange resin, permits sodium to be exchanged for potassium in the intestines, reducing the serum potassium levels. That is part of physiological adaptation, which is the third largest section on the NCLEX. Megan, did you get it wrong? Oh, Megan, you were on a roll. You were on a roll. All right. You were on a roll. Hey, so one of the things that are super important, ladies and gentlemen, when you guys are reading your questions and trying to understand your rationales, read why the answer is correct, but then also read why these answers are incorrect. All right. When you guys are studying, go back to your question, understand your question, what it's asking, and then understand why that's the correct answer and why these are not the correct answers. That is part of it. OK, that is a part. Content, Q&A, reading and reviewing your rationales. OK, that is what you guys have to do. Here we go. Question 19. Mario has a burn injury. After 48 hours, the physician orders for Mario 2 liters of IV fluid to be administered Q12 hours. The drip factor of the tubing is 10 drops per ml. The nurse should set the flow rate to provide, what is it, 18, 28, 32, or 36. Just graduated my LPN studying for the NCLEX. Shout out to you, 78. Shout out to y'all. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Y'all. Got them off nurselabs.com. Make sure you guys go over there and check that out for yourself. Also, smash that like button. Smash it. Share button. Share it. Follow button. Follow it. AKA me. The more me, the more y'all. Trust and believe me when I tell y'all that. We've had 4 or 5 people come in here and tell us that they passed their NCLEX. Hey, and that's what I'm all about. Giving back to y'all. Promise you. What are we thinking? I'm going to give y'all 10 seconds. 10 seconds, y'all. Also, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. I need time to do math. Jamie, come on. You should be a TI-84 calculator right now. All right, y'all, here we go. Here's our answer in 3, 2, and the answer is 28, right? This is the correct flow rate. Multiply the amount to be infused, which is 2,000 mLs, by the drop factor, which is 10, and divide the result by the amount of time in minutes. So 12 hours times 60 minutes, right? Pharmacological and parenteral therapies, dimensional analysis. It says first semester. Okay. Akron, Ohio. Okay. All right. Hey, it's dangerous in Ohio. I hear people be walking around with blickies just because they could do what they want. I don't know how true that is, but you know the deal. Shout out to Jersey. Shout out to Ohio. All right, y'all, here we go. Pharmacological and parenteral therapy, second largest section on the NCLEX, okay? Second largest section on the NCLEX. It doesn't matter if you're taking the RN or if you're taking the PN exam, okay? Question 20, Terrence suffered from burn injury. Using the rule of 9, which has the largest percentage of burns? Face and neck, right upper arm and penis, or is it the right thigh and penis, or the upper trunk? What are we thinking? What are we thinking? What are we thinking? Hey, we're trying to get to 50,000 likes. If you guys are new here, welcome. We're doing NCLEX questions. Make sure y'all smash that like button. 50,000 likes. 50,000 likes. I think a bunch of people got carpal tunnel now. 50,000 likes. Should I do ADN or BSN if I want to? You can be an ADN nurse and travel. And let me tell you something. The difference between an ADN nurse and a BSN nurse is just the level of the degree, but the license is the same. That's what I'm saying. The license is the same. That's it. All right. All right, y'all. Here we go. People screaming D. Some people screaming C. Where are you from? I live in Texas. Shout out to Texas. Hold on one second. So I got to get somebody at 600 because they're trying to sell me nudies again. And you already know. Hey, look. What's the deal? Why buy nudies when you can get them for free? Yeah, I said it. Here we go. Here's our answer. Here's our answer in 3, 2. All right. Jocelyn NY. Okay. How the nursing jobs look in Texas. They exactly how you think they look. The answer is upper trunk. The percentage designated for each burnt part of the body using the rule of 9. Head and neck is 9%. Upper right extremity, 9%. Upper left extremity, 9%. Anterior trunk and posterior trunk are both 18% separately. The right lower extremity is 18%. Left lower extremity, 18%. Perineal, so penis, vagina area, 1%. Physiological adaptation. Megan, oh my God. Oh, Megan, you're on a roll. Hey, y'all can still take Megan as a good luck charm to y'all's test, though, okay? But Megan, she was on a roll, all right? Physiological adaptation, third largest section on the NCLEX, all right? Ladies and gentlemen, real quick, commercial break. Don't you go nowhere, all right? We're doing NCLEX questions. Make sure you guys participate. I'm kind of funny. Probably not as funny today because, it's Monday, but, whatever. Make sure you guys share. Make sure you guys follow and give me all them likes. Give me all them likes and make sure you guys share because don't be greedy. Share it to other people that you think may know it. If you guys are in school, share it to your cohort. I don't care if you're in your first semester or if you're in your last semester. Share it, okay? Also, you come to my chat, try to sell me your nudes. If you're rude or if you're rushing me, I'm going to ban that ass. Literally, it says, which is how long I'm going to ban that ass. AKA, I'm just going to ban you forever. So don't be rude. Nurseslabs.com is where I got these questions from. You guys can go over there and check that out for yourself. Also, 7-day NCLEX course. If you're a brand new nursing student and you're just in your program and you don't graduate for a year to 2 years, get you a $48 NCLEX review that you have for a lifetime. Not on a subscription, not on anything like that. You get it for a lifetime. Go over there and check it out. It's going away. Okay, what was your rank in the Navy, sir? I'm a hospital corpsman, first class, so I'm an E6. All right, here we go. Question number 21. Herbert, a 45-year-old construction engineer, is brought to the hospital unconscious after falling from a 2-story building. When assessing the client, the nurse would be most concerned if the assessment revealed what? Reactive pupils, a depressed fontanelle, bleeding from the ears, or an elevated temperature. You're welcome. Hey, if you guys are new here, welcome. We're doing NCLEX questions, y'all. NCLEX questions. We got them off of nurseslabs.com. Make sure you guys go over there and check those out for yourself. Also, if you're new here, I want to know who you are, where you're from, where you were at in your nursing journey. Who are you? Where are you from? Where you at in your nursing journey? And if you're not a nurse, what you doing here hanging out? Trying to get your learn on, trying to learn something different. All right, I'm going to give y'all 15 seconds. Kevin, do you do one-on-one tutoring? Oh my God, Kevin, get your speech together. Sarah, I do one-on-one tutoring. You can check that link out. That link is in my bio and it's labeled NCLEX one-on-one coaching. My mom, what? My mom is in here watching. Shout out to your mom, Megan. Hey, first of all, Megan, it's no longer your mom. She's our mom, okay? It's not your mom. She's our mom. So what's up, Megan's mom? Here we go, y'all. Here's our answer in 3, 2, And the answer is bleeding from the ears, right? Megan said deal. Okay. The nurse needs to perform a thorough assessment that could indicate alterations of cerebral function, including intracranial pressure, fractures, and bleeding. Bleeding from the ears occurs when the basal skull fractures that can easily contribute to increased intracranial pressure and brain herniation. That is part of physiological adaptation, right? So think about it. My man fell 2 stories and now he's bleeding from his ear. That can't be good, right? Can't be good at all. Also check for clear fluids in the nose, right? Yep. So we're going to be looking for that clear fluid in the nose. We want to look for that halo effect, right? In case there's CSF. 9 times out of 10, if my man hit his head like that, he's probably going to have some CSF. He's going to have some blood and some CSF in his ears, okay? So, hey, physiological adaptation, 3rd largest section on the NCLEX at 11 to 17%. All right, I'm a billing encoder. I've been considering hey, let me tell you something. Lovely 77 or Lovely 777. You being a medical billing encoder and then getting a nursing degree is awesome because you can work from home and make like $100K doing billing and coding and then having an RN behind that. Listen, stop playing with me, girl. You better stop playing. You better go get that money. Here we go. Question 22. Nurse Sherry is teaching male client regarding his permanent artificial pacemaker. Which information given by the nurse shows her knowledge deficit about the artificial cardiac pacemaker? AKA, what did the nurse say that was wrong, that is incorrect about a pacemaker, right? Take the pulse rate once a day in the morning upon awaking. May be allowed to use electronic appliances, have regular follow-up care, or may engage in contact sports. What does it say? It says ATI what? It says, yes, always think ahead. Always think ahead. I'm trying to tell y'all with a nursing license, not necessarily a degree, but your license, I'm telling you right now, it's like it opens up so many doors that people don't even realize. All right. So I'm going to read the question. The last part, it says, which information given by the nurse shows her deficit? Meaning, what did she say that was incorrect? Do you get a job right after you graduate? If you apply for one, and you got to look around, you got to apply. My recommendation to everybody, go to a level 1 trauma facility after you get your nursing license and you graduate, or you graduate, get your nursing license. All right. That's what listen to me. Hindsight's 2020. I wish I would have did it, but I didn't. So here we go. Here's our answer, y'all, in 3, 2. And the answer is D, may engage in contact sports. The client should be advised by the nurse to avoid contact sports. This will prevent trauma in the area of the pacemaker generator, right? I don't need be going out there playing football and then getting blasted on the field. And next, you hit my pacemaker. And next, I start having some type of ventricular arrhythmias, or I just start, my heart just decides it doesn't want to fire. You know what I'm saying? So what not to say? That's what I said. What not to say, right? Hey, lovely. I said it twice. Hey, RTFQ. Why do you recommend a trauma unit? I recommend going, you're talking about why do I recommend going to a level 1 trauma facility? Because you essentially have everyone and everything there. Oh, also, that's part of health promotions and maintenance. You have everyone and everything, and it's a teaching hospital, right? That's my recommendation, right? And you have residents. You have so many people. Read the question twice, bet. That's not what I said. RTFQ means read the fucking question. It means read the effing question, the explicit F word. Hey, if you're not a nurse and you're soon to be one, the F word is going to be your favorite word, I promise you. I work at a level 1 trauma facility. It's amazing. I bet it is. All right, here we go. Question 23. The nurse is aware that the most relevant knowledge about oxygen administration to a male client with COPD is O2 at 1 to 2 liters per minute is given to maintain hypoxic stimulus for breathing. Hypoxia stimulates the central chemoreceptor receptors in the medulla that makes the client breathe. Oxygen is administered best using a non-rebreather mask, or blood gases are monitored using a pulse oximeter. What are we thinking? A's. Also, if you guys are new here, welcome. We're doing NCLEX questions. Got them off of nurseslabs.com. Also, hey, we're trying to get to 50,000 likes. 50,000 likes. Should be a Venturi. Okay, maybe. Should be. Well, we're about to find out what it is, ain't we? Hey, so like I said, if you guys are new here, welcome. Hey, make sure you guys smash that like button. Trying to get to 50,000 likes. Also, if you're new here, I want to know who you are, where you're from, where you're at your nursing journey. Pamper Me Nails Cypress. Really? Sky, appreciate the follow. Is it Insane. Is it Insang? Thank you for the follow. Appreciate you. Appreciate you. DeLorean. Like the car, like all Back to the Future. It says, Bank Abby, how good is the boot review stuff? I'm considering trying it. So right now it's full of content, and I actually have a new generation NCLEX review. Abby, if you hang around towards the end, I'm going to show you what's inside of the course. And also one of the biggest things, Abby, is that you get all of the updates that are going to get uploaded. Who asked me what's the answer? Hey, don't be coming over here rushing me, Bella. Okay. All right, here we go. And the answer is A. Oxygen is 1 to 2 liters per minute is given to maintain hypoxic stimulus for breathing. COPD causes a chronic CO2 retention that renders the medulla insensitive to CO2 stimulation for breathing. The hypoxic stage of the client then begins the stimulus for breathing. Giving the client oxygen in low concentration will maintain the client's hypoxic drive. That is part of physiological adaptation, which is the third largest section on the NCLEX. College Station, you must go to A&M. Sherry, you go to A&M? That's the only reason. You're from the Valley. Who is that? Is it Anselmo? Anselmo? I done messed it up. My bad. I'm sorry. So nice to be here. I'm glad that you're here, Bueno. I'm glad that you're here. All right. Hey, physiological adaptation, third largest section on the NCLEX, 11 to 17%. Remember, read your rationales. Read and review your rationales. Ladies and gentlemen, we are at 50,000 likes. I appreciate y'all. You already know what to do. Hit it some more, baby. Hit it some more. Question 24. Tony has undergone a left thoracotomy and a partial pneumonectomy. All right. Hey, medical terminology. Remember what we're talking about. Paint the picture. Okay. Chest tubes are inserted and 1 bottle water seal drainage is instituted in the operating room in the post anesthesia care unit, aka the PACU. Tony is placed in Fowler's position on either his right side or on his back. The nurse is aware that this position does what? All right. Is it reduce incisional pain, facilitate ventilation of the left lung, equalizes pressure in the pleural space, or increase venous return? What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Make sure you guys go over there and check that out. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys participate. We had a bunch of people come in here earlier today, tell us that they passed their NCLEX. A couple of people came in here, said that they used the 7-day NCLEX course review. That's in there right now. Like I said, I have a new generation NCLEX review. I go through 100 questions. 100 questions. What's up, Betty from Canada? I see you. I go over 100 questions, talk about the topic of the question as well as we talk about the rationales and we break them down. Okay. For $48. It's for $48 and you get it for a lifetime. All right, here we go, y'all. Here's our answer. Here is it Alejandra? You say B with a question mark. You sure? Jackie, appreciate the share. Here we go. Here's our answer in 3, 2, and the answer is B, facilitate ventilation of the left lung. Since only a partial pneumonectomy is done, there's no need to promote expansion of this remaining left lung by positioning the client on the opposite unoperated side. It is part of physiological adaptation, the third largest section on the NCLEX. This is irrelevant, but does anyone know the formula for MAP? Like you talking about mean arterial pressure? Y'all let her know. Just passed that NCLEX in Jersey. Kristen, you passed NCLEX? When? When'd you pass NCLEX? Today? I mean, not today, but you found out today? Let us know, Kristen. Everybody right now. Everybody tell Kristen Elizabeth right now that y'all are proud of her. Right now. Tell her that y'all love her. Y'all don't even got to know her to love her. You know what I'm saying? Congratulations. Congratulations on passing. All right. Here we go. Physiological adaptation, third largest section. Remember, read your rationales. They are a part of the study process. If you ever do one-on-one coaching with me, trust and believe me, I will hammer that down your throat. Because if you don't do it, best believe you're gonna hear some other words from me. All right. Hey, I'm a real assertive coach. All right. I don't be playing no games. All right. I'm just letting y'all know. Hey, tread lightly. Question 25. Christine is scheduled for a bronchoscopy. When teaching Christine what to expect afterward, the nurse's highest priority of information would be what? Food and fluids will be held for at least 2 hours. Water saline gargles will be done Q2 hours. Coughing and deep breathing exercises will be done every 2 hours. Or only ice chips and cold liquid will be allowed initially. What are we thinking? Think about a bronchoscopy. right? Paint the picture. How does that process go? What is the most important thing I need to be thinking about? Okay. Shout out to all 432 of y'all. We're doing NCLEX questions. I got them off nurselabs.com. Zoe, thank you for the follow. Appreciate you. Appreciate you. I see Kat down there. I see Kat just jump into the chat. Kristen says ABCs. Okay. Hey, if you guys want to elaborate in the chat, you very well can do that. All right. Candy, thank you for the follow. Appreciate you. I'm gonna give y'all 10 seconds. All right. What are we thinking? What are we thinking? Breathing. Okay. Airway. There we go. Okay. I'm a nurse and I'm joining these. That's okay. Genesis. We got plenty of, I got some doctors that jump up in here. Some doctors, some residents, some PAs. You is no different, madam. You is no different. Catherine, thank you for the follow. Nisha, thank you for the follow. Appreciate you. All right, y'all. Here we go. Here's our answer. Here is our answer. In 3, 2, and the answer is A. Food and fluids will be held for at least 2 hours prior to bronchoscopies, right? The doctors spray the back of the throat with anesthetic to minimize the gag reflex and thus facilitates the insertion of the bronchial scope. Giving the client food and drinks after the procedure without checking on the return of the gag reflex can cause the client to aspirate. The gag reflex usually returns after 2 hours. Yeah, that's a trick question, right? So as a reduction of risk potential. However, that leads into an airway compromise though, right? Does it not? Risk for aspiration can then lead to airway compromise, right? Airway breathing. Okay. So that's why it's so important. That's why I like when this question comes up. I've seen this question pop up multiple times, but this is why I like for it to come up. Some people are just like, I got the answer, Kevin. I'm like, you lying. So it's okay. This is why it's important that we go through our questions and our rationales. Hey, real quick. Hey, we're doing nursing questions, NCLEX questions. I got them off nurselabs.com. Go over there and check them out for yourself, okay? They also do nursing diagnosis for all my nursing students, right? Participation is the key. I'm funny sometimes. Sometimes though. Make sure you guys share. Make sure you guys follow. Make sure you guys like. Hey, goal right now, 60,000 likes, baby. Make it happen. Don't be selfish your whole life. Share this to people that you feel may need it. You're a nursing student in your first semester or last semester. Share it to your cohort. All right. Hey, if you come into my chat and you start acting a fool or start rushing me or telling me how to run my chat, I'm going to ban that ass. Literally, it says it right there. I'm going to ban that ass. Okay. So don't be rude. All right. 7-day NCLEX course, $48 for a lifetime, ladies and gentlemen. That price is going up after Thanksgiving. Okay. So I'm telling you, go over there and check it out. Those links are in my bio. You need one-on-one coaching and tutoring. Link in my bio. All right. And we're going to do an Ask Me Anything after this. It says, do you have any testing strategy videos? Ali, I'm actually working on, hold on one second, y'all. Hold on. I got to give somebody a 600. Hold on. Oh, hey, I had to give 3 600s today and it's been great. So, test taking strategy videos are coming up right now. I actually have a video in there called Answering NCLEX Style Questions. That's in there right now. But hey, once you get it for $48, you get it forever. So every video that I upload in there, you're going to get. Okay. I am from Texas. Here we go. Question 26. Nurse Tristan is caring for a client with acute renal failure. The nurse should expect hypertonic glucose, insulin infusion, and sodium bicarbonate to be used to treat what? Is it hypernatremia, hyperkalemia, or hypercalcemia? Everybody's saying C. Is it Pow? Is it Pow? I'm fucking that up. I'm sorry. That's nothing but love. But you say D. Okay. Let's see what else we got going on. Steph says C. Okay, say C. Barbara says A. Ashley, and is it Layla? Thank you for the follow. Appreciate you. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys like, share, follow. The likes is what, hey, we need 60,000 likes. We almost there. We almost there, y'all. We almost there. Hey, a little bit about me for y'all that are new. Been a nurse for 3.5 years. Worked in the ICU, specifically a burn ICU, a medical and a neuro ICU. Worked in the OR, worked in PACU. Been in the Navy for 16 years, 2 deployments. I'm a trauma nurse instructor. I was a combat casualty instructor, pre-hospital trauma, taught burns. I was a surgical tech instructor for about 3.5 years, if I don't already said that. But hey, in case y'all don't know, I have a little bit of a background in teaching, and I love doing this for y'all. All right, here we go, y'all. Here's our answer. How was the PACU? Loved it. Honestly, I think the PACU is the holy grail, even better than the OR. Not even gonna lie to you. Jules, thank you for I appreciate your support. Thank you. Here we go. Here's our answer. Our answer is C, hyperkalemia. Hyperkalemia is a common complication of acute renal failure. It's life-threatening if immediate action isn't taken to reverse it. The administration of glucose and regular insulin with sodium bicarbonate, if necessary, can temporarily prevent cardiac arrest by moving potassium into the cells and temporarily reducing serum potassium levels, right? Hey, so even when we have people that go into DKA, same type of protocol, right? Right? Diabetic ketoacidosis, same type of protocol. We need that insulin to move it out of or push it into the cells, right? So we can get it out of the bloodstream, right? But then there's also other ways that we can get rid of it out of the cells, right? Think about K-exalate, right? Passing the K, you're getting the K out through the bowels, right? Took NCLEX 20 years ago. It's not the same. It's not the same. It's not the same. We lost you. Wait, what happened? What happened? Can y'all hear me? Can you guys hear me? Hey, give me a thumbs up if you guys can hear me. I don't want to go on if you guys can't hear me. Yes? Abby says yes. Okay. You can't hear me. I don't know what's whoever says that. Who is this right here? Is it Elise? Hey, back out of TikTok and come back in. Y'all, hey, I don't know if she can hear me or that person can hear me out. Y'all like type it in the chat so they can see it. Okay. Here we go. Question 27. Miss X. She might be married to Elon Musk, but Miss X has just been diagnosed with genital warts. What information is appropriate to tell this client? This condition puts her at high risk for cervical cancer. Therefore, she should have a pap smear annually. The most common treatment is Flagyl, which should eradicate the problem within 7 to 10 days. The potential for transmission to her sexual partner will be eliminated if condoms are used every time they have sexual intercourse. HPV, which causes genital warts, can't be transmitted during oral sex. What are we thinking? Is your name Bianca? Is that it is? Bianca? Hey, if that's your name, if I said it right, give me a thumbs up. Okay, appreciate the roses. Real talk, appreciate the roses. Okay, Bianca, I just want to make sure I said your name right. I've never seen that name before, me personally, so I pride myself on trying to say people's names right. And yours just stuck out. I was like, Bianca. Girl, that's different. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Make sure you guys smash that like button. Hey, we're 70,000 likes. Hey, let's get there. Let's get there. 70,000 likes. Let's make it happen. All right. Is it Akashdeep? Thank you for the follow. Appreciate you. Hopefully I said that right. Hopefully I said your name right. All right, y'all. Here we go. Here's our answer. Here is our answer. Tito, thank you for the follow. And there we go. And the answer is A. This condition puts her at high risk for cervical cancer. Therefore, she should have an annual pap smear. Women with genital warts are at high risk for cervical cancer or for cancer of the cervix and vulva. Yearly pap smears are very important for early detection because genital warts is a virus and it does not have a cure. Physiological adaptation. Third largest section on the NCLEX. This was on my test today. Shout out to you, Kim. It was on your test. So, hey, at least we know that these types of questions are helpful. Remember, when you guys are doing your when you guys are doing your studying, content, questions and answers, rationales, right? Don't ever deviate from them. I always doubt myself. Ma'am, I'm going to need for you not to do that. I'm going to need for you to have all of the courage in the world. Now, if you truly don't know something, then, hey, raise your hand and be like, hey, yo, Kev, I don't know that. And I'm going to be like, all right, cool. Let's go find it out. Let's find out the answer. All right. How do you register for the NCLEX? I mean, I can't really go into that answer right now. If you ask me that question later, we can talk about it. Or somebody answer her question right now. Here we go. Question number 28. Is it Mardites? I'm pretty sure I butchered that name. Was recently diagnosed with was it a genital urinary problem and is being examined in the emergency department. When palpating her kidneys, the nurse should keep which anatomical fact in mind? The left kidney usually is slightly higher than the right one. The kidneys are situated just above the adrenal gland. The average kidney is approximately 5 centimeters long and 2 to 3 centimeters, 3/4 inch to, or 3, hold on. Oh yeah, so it's that, yeah, so it's 2 to 3 centimeters wide. The kidneys lie between the 10th and 12th thoracic vertebrae. What are we thinking? What are we thinking? Shout out to all y'all that are in here, smashing that like button. Hey, we need to get 70,000 likes, y'all. Hey, get carpal tunnel for me right now. Get carpal tunnel. Everybody wants me to do this tomorrow. So, hey, the incentive of me doing that tomorrow is just smashing that like button. So, Smashing it. Carpal tunnel for me, baby. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Say, no, I already have carpal tunnel. All right, Gabby, that's fair. I don't want you to get carpal tunnel on account of me. So just use your toes then to put the phone on the floor and just start tapping it with your feet. Thank you for helping us, though. It's really great. Hey, Kim, I really do enjoy this, right? What was the last question to last? What was the last answer to the last question? Char, I wish I could tell you. I don't know. We don't go back. What time do you usually do these labs? I do them 5:30 Central Standard Time, Monday, Tuesday, or Monday, Thursday, Monday, Wednesday, Friday. Lord have mercy. All right, here we go. And the answer is A. The left kidney usually is slightly higher than the right one. Yeah, so it's slightly higher than the right one, and the adrenal gland lies atop of each kidney. Okay. It says, if I get carpal tunnel, I'm coming for you. Hey, look, I live in San Antonio. You can come find me. City's pretty fucking big, though. I'm just saying. All right. It says, babe, make sure you're screenshotting. Antonio, what does that mean? Antonio, why are we screenshotting? Why screenshot when you can just go to the website and go get it? That's why I keep quiet. Oh, I don't know what that means. I don't know what that means. Shout out to Countdown City. Hey, here we go. Question. It says, no, we ghetto. You ghetto because you're lazy as hell and you can't go to the fucking website? What is that? That doesn't even make no sense, sir. What the hell? Lord have mercy. All right, here we go. Question 29. Gestoni with chronic renal failure is admitted to the urology unit. The nurse is aware that the diagnostic test is consistent with CRF if the result is what? They said, I love it here. I'm glad you love it here. I love it here too. Is it increased pH will decrease hydrogen ions, increase serum levels of potassium, magnesium, and calcium, blood urea nitrogen, 100 milligrams per deciliter, and creatinine is 6.5 milligrams per deciliter? Or is it the uric acid analysis is 3.5 milligrams per deciliter, and the PSP excretion is 75%? What are we thinking? I just want to let y'all know there's some words I won't even try to pronounce because do I look like a 10-year-old getting ready for a spelling bee? Absolutely not. So, MLS. Okay. All right. What else are we thinking? Who else is going to screenshot this damn live and not go to the fucking website? Y'all are wild. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Any help with EKGs? Well, we don't have an EKG question on here. So unfortunately, these questions are just random. So whatever pops up is whatever pops up. I know that creatinine is extremely high. I know that's right. Hey, we got these questions off nurseslabs.com. You guys can go over there and check those out. They're free sets of questions. So if you need help with EKGs or anything else, you guys can go over there and check those out as well. Okay. Who said that I'm a respiratory therapist? Shout out to you, Katie. Hey, I love my respiratory therapist. I learned everything I ever needed to know from the vent from respiratory therapist. Hey, Kevin. Hey, what's up? How are you? Who said that? Is it Monet? You're funny as hell and I'm all for it. Hey, Abby, look. This is what I do every time. Also, if anybody wants to see any of the other lives I did, you guys can go over to my YouTube channel at The Boot Nurse. And every live that I do will go up there as well. Katie, you're welcome. Hey, but if you're a respiratory therapist, an LPN, LVN, PCT, CNA, whatever, right? Occupational therapist, whatever. Like, I love y'all. Every single one of y'all, because I'm telling you, as a nurse who had no type of help in the ICU, I fucking love every single one of y'all. It says we got the 80K. Hey, let's get the 80K. Let's make it happen, baby. Lab techs. Hey, I just want to let y'all know the lab techs be fucking up my specimens. Okay, all right. Nothing hemolyzed. Okay, you're just lazy. Yeah, I said it. Hey, Christiana, don't do that. Don't do that. Here we go. Blood urea nitrogen and that creatinine, high. Okay. Reduction of risk potential. I said, we love you too. This will really help. Seriously. I'm glad this will help you. Okay. Reduction of risk potential. Okay. Smaller section on the NCLEX, 9 to 12%. It says, man, I miss you were washing students on NCLEX. You could tell them all to chill out. I would. I tell everybody, hey, fucking relax. Hey, I failed my NCLEX 3 times, y'all. Three times. Not once, not twice, but 3 times. You hear me? So let me tell you something right now. Every single one of y'all that's in school and that's going to take your exam, you can pass this exam. Don't let this fucking exam destroy your whole thought process. If you failing the exam is the worst thing that happens to you, I think it's okay. Perspective. You could be in a different part of the world really fucking suffering right now, but you're over here worried about an exam. Okay. Trust and believe me when I tell you that. Here we go. Question 3. Katrina has an abnormal result of a PAP test. After admitting that she read her chart while the nurse was out of the room, Katrina asked what dysplasia means. Which definition should the nurse provide? What are we thinking? You're welcome. I'm guilty at peeking at the computer, just like Katrina when they leave the room for too long. Hey, Jamie. Oh, man. It says 95. I can't imagine taking it again. Terry, look. Actually, I can say right now, hindsight's 2020. At least for me, I look at NCLEX stuff every single day. So it's like I couldn't fail it if I wanted to. And remember, I didn't say nothing about getting every answer right. I said failing it. There's a big difference between getting every answer right and failing it. You don't want to fail it, but you don't have to get every question right. You just need to get enough to pass. Okay. Hey, if you're new here, we got these questions off nurseslabs.com. Make sure you guys like, share, follow. Hey, we're shooting for 80,000 likes, baby. 80,000 likes. Let's make it happen. 80,000 likes. All right, y'all. Here we go. Here's our answer. In 3, 2, and the answer is D. Alteration in the size, shape, and organization of differentiated cells. Dysplasia refers to the alteration of the size, shape, and organization of differentiated cells. That is physiological adaptation. I'm not a nurse, but an EMT. Mina, that's okay. You're a nurse in training. That's okay. You're a nurse in training. That's all good. Or you're a medical professional of higher learning in training. So if you want to go be a paramedic, or if you're an EMTB or whatever you are, you want to be a paramedic, PA, nurse practitioner, doctor, whatever, you're in training. Hey, always expand your knowledge. There's nothing wrong with that. Physiological adaptation, third largest section on the NCLEX, 11 to 17%. I appreciate y'all. Your medical prefixes, it will take you so far. Facts, they sure will. They sure will. They will help you. They will help you break down every single thing that you could think of when it comes to learning those words that are in question that you have no idea what the fuck they mean. All right. So here we go. Ladies and gentlemen, that is it. That is it for our questions. Hey, but stick around. Stick around. We're going to do an Ask Me Anything. You're a professional patient. Lord have mercy, Lauren. Really? That's okay. A professional patient is cool because that means to tell me that you're nice and you know how to converse and and how to treat people, which is cool. Hey, so thank you for hanging out and participating. I appreciate all the loves and all the likes. I legit do. I gave like 4 people 600s and that's because they were trying to sell me nudies, and I told them I don't need their nudies when I can get them for free. I'm petty over 9,000. So if you come over here, start doing stupid shit, I promise you I will ban you. Shout out to my x-ray techs and my medical assistant. Shout out to y'all. Also, like I said, I got these questions off nurseslabs.com. You guys can go over there and check those out for yourself. 7-day NCLEX course. It's in its pre-launch phase. And hey, it's going away. Thursday is the last day you can get it for $48. You're getting it for a lifetime. And as a matter of fact, I'm about to show every single one of y'all. Drop your YouTube channel. The YouTube channel is The Boot Nurse. Go into the search engine or go to my link in my bio. It says it right there. Go to YouTube. It'll take you directly to my YouTube channel. All right. Now, at the request of Bank Abby. All right, Abs, I got you. All right, here we go. This is what the website looks like. All right. This is what the website looks like for everybody that's curious. This is the 7-day NCLEX course, okay? 7-day NCLEX course. That's me talking and blah, 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 right? I look gorgeous, darling. Gorgeous, gorgeous, all right? So, and it is for RNs and LPNs, right? And it's an on-demand course. On demand, okay? And it says it right there. For $48, it ends at this day on this time. Notice that the timer's up here. I'm telling you right now, on Friday, it won't be there. I promise you, right? So we'll scroll down. We talk about mindset. I'm telling you, there's still a bunch of videos. There's going to be 150 videos that's going to go up there. All right. There's going to be over 150 videos that are going to be on there. Okay. And also, here we go. Here's the curriculum, right? Here's the curriculum. So talk about critical thinking, the rules on NCLEX, the review, Look, day 1, we talk about management of care all the way down to day 7. Also, you get the path to conquer the NCLEX, right? And I'm going to show you guys exactly what that looks like. I'm going to show you exactly what it looks like, right? But this is what the main page looks like. Hey, y'all, remember, I told you I failed NCLEX 3 times. I spent total on reviews and taking my exam almost $3,000, right? I spent all that money, so y'all didn't have to, so I can make this. And that's me, my gorgeous self at the Burn Center. Let me stop. Anyways, a little synopsis, you guys can go over there and read that, who it's for, right? Couple of testimonies, some coaching. And with this coaching, when you guys listen to them, the coaching, literally coaching them, that's what turned it into the program, okay? I'm just letting y'all know right now. And also, if you don't like it, 7 days, boom. Right there, you get it. You get your money back. But I can tell you right now, I haven't had anybody give me their money back as soon as like the review and stuff went in there. Now, Abby, here we go. Just subscribe to my channel. I appreciate you. Now, Abby, here we go. Here we go. All right. Now look over here towards the left. So here's the videos, right? Once you go in, once you get into the program, this is what you'll see, right? We'll sit here. You'll see me talking, all that good jazz. I got a nice little white shirt on. We have a table of content. We go over, talking about computer adaptive testing. We talk about how does it work, passing, like you get a question right. You go up and they give you a harder question. You get that question right, they go up and they give you a harder question. You get this question wrong, they'll give you an easier question, right? That's how it works. Yes, yes. And he said it's a go. Is it Christy? Go to the website and that's what it'll say. You get it for a lifetime. You get it for a lifetime, right? And so let me scroll down here. Like you can also see right here, we talk about critical thinking, right? And also all the videos that I have on here, they are not, they're no longer than 30 minutes. No longer than 30 minutes. Why? Because who the hell wants to, remember, I teach, you guys. I teach formally, like on a podium. Who wants to sit up on a podium and talk for 50 minutes to an hour? Not me. So guess what? Get you 22 minutes, sit there, get you some content in. All right. All right. So here we go. Talk about answering NCLEX style questions. And then right here, right? So here's the review. Here's the review. This is what everybody's been waiting for. All right. I'm going to turn this so you guys can see it. All right. Abby, where's Abs at? Abby, look, this is what you've been asking for, right? So this is part one. Right. So we talk about what's in the content, right? We talk about the testing structure. We talk about the things that have changed within the NCLEX. Right. And then we also talk about the new types of questions, the testing structure. And then we talk about the length of the test. Right. It says, I think the taint should be celebrated. I don't know what does that mean? What does that mean? All right. And then we go through questions. Right. We go through questions. I read them. We break the question down, talk about, so what do you think this question is asking, right? So what is the topic of it based off of the information that's given us in the question? And the topic is a foreign body aspiration, right? And it's because we have an infant that's choking, probably because they have something in their throat, right? So it's going to be like, what should I do next? And systematic approach, what should be the next thing that I should do, right? And then we hit play. And then I tell you why I tell you, hey, this is incorrect because of X, Y, and Z. This is incorrect because of X, Y, and Z. This is correct because of X, Y, and Z. Those are our rationales, right? So that's what I go through. Listen, for this review alone, for the NGN review, right? That's 100 questions. Listen, I'm going to show you right now. It's 100 questions, right? I already went all the way there. So boom. So it's question 99. And then we have question 100. That's 100 questions. Please, when does it? So I don't know how to, is it Shaylu? It is on demand. So once you purchase it, it's yours and you get all of the updates, meaning every video that I upload, you're going to get. Okay. So every video that I upload, you're going to get, yes, you get it for $48 and yes, it will go away on Friday. It won't be there for $48. It'll be $97. Okay. So I'm telling you, go over there and get it right now. And we talk about, how to evaluate, your progress. Talk about the, a 3-step study plan. We talk about tips and tricks and memory tricks and stuff like that. Some of these things could look familiar to y'all, right? And things to look out for when you guys are doing that, right? And then also, like, look at this, y'all. Let me show you. I'm going to show you right now. How do I register with this class, your 7-day class? So that link is in my bio. Go up to my little, up here, my name, right? And then click on the link in my bio, and it'll take you to the 7-day NCLEX course, and you'll see it right there for $48. I promise you. I promise you it's there. But look, right here, here's our content. Here's our content right here. Talk about time management, lab values, legal and responsibilities, right? Delegation, restraints, how to create a study plan. Y'all, there are 18 videos. Y'all see that? There are 18 pharmacology videos. 18. 1-8. I'm not even gonna lie to you. I think my favorite one is the cardiovascular meds. I'm gonna show you guys, right? And this one is 16 minutes. 16 minutes, right? I'm gonna show you guys, right? Talk about, here's our intro, so on and so forth. Cardiovascular meds, talk about our ACE inhibitors. We talk about our ARBs whenever I get there, right? And so here's our examples of our ACE inhibitors. Notice our ACE inhibitors, they all end with what? Pril. There we go. Bobby says, do you think this will help with my finals as well as NCLEX? Absolutely. It says, child, let me go grab that real quick. Monet, go ahead and go grab that. As a matter of fact, if you go and you purchase it right now, I want you to come back in the chat, and I want you to fact check me. Like, if you guys are seeing what I'm seeing, I want you to come back and I want you to fact check me right now and being like, y'all, it's exactly whatever he's showing you. That's exactly what it is. I promise you. That's exactly what it is. Right. And so here are what are they? Our ARBs. So we got our sartans, right? I don't know if everybody can see that. Hopefully you can. I know it's a little blurry, right? Beta blockers, calcium channel blockers. Examples are statins, our anticoagulants, antiplatelets, our diuretics, anticoagulants, got our DIG, right? Vasodilators, antiarrhythmic medications, and then we have a nice little chart, right, of the contraindications, you know what I'm saying? And then also, look, you can download the same PowerPoint that I'm going over so you can do it with me. You can download it, and that's in there inside the program. You get it for $48, right? $48, and I'm telling you, it's going away. It's going away. On Friday, it will not be there. I promise you. All right? Like I said, 18 pharmacology videos. And in another set of videos, I got fluid and electrolyte imbalances. We talk about fluid regulation and our hypos and our hypers. So our kalemias, neutremias, calcemias, magnesias, right? Right now in production are my cardiology section. We have our endocrine section right here. And then, of course, I haven't added anything down here where it's help improve the course, but I'm going to put like a little survey down there. All right. So that's what you get. That is what you guys get when you guys get the NCLEX course. It says, me too, got to go get that. I'm trying to tell you, go get it because it's going to go away. I promise you. There's a countdown that's on there too. All right. But yo, what's up, y'all? How y'all doing? How are y'all doing? Welcome. Hey, if my eyes look red, it's because I took a nap earlier. All right. It ain't because of what you think it is, you crazies. I got a license and I like it. It says, so. Okay, so you said once we buy it, it's ours. We can go back to it. Absolutely. It's an on-demand course. So you can just go. You can go in as much as you want. Okay. Hey, so welcome. My name's Kevin. Been a nurse for 3.5 years. I am the creator of the 7-day NCLEX course. That is my baby. Y'all, remember, I failed my NCLEX 3 times. The last thing I ever want anybody to feel is like, they're a failure. All right. And I created that because you hear nothing but words of positivity coming from somebody who was unsuccessful at that exam. Right. It's not just some other review out here saying like, hey, use this review. It's relatable. It's relatable to you. It's relatable to anybody that decides that they want to get it. Right. It says, thank you. You're a blessing for sure. Is it Amari? I appreciate you. But yeah, so like make sure you guys go over there, click the link up there, and that will definitely take you to everything that I have that's over there, right? Also, if you're looking for one-on-one coaching, I do one-on-one coaching for NCLEX as well. It's exactly kind of how I do these lives, but they're one-on-one, they're personal, and it's all about you. It says, Chrissy says, you look like Julian from the Best Man movie, handsome. Oh, hey, I ain't never been nobody's best man at a wedding, but I appreciate it. But yeah, you guys can go over there and check that out. What questions do you guys have? Hey, y'all, we got to 80,000 likes, 81.3K. That's the most likes I've ever had. And for the fact that everybody that came in here smashed that like button and got me to 81,000 likes, I will be here tomorrow and we will do the same exact thing. I just registered in success. How do I join? So you should get an email. Or right after you join, you should get that it should take you to that thank you page, and you click on that thank you page, and it should take you right to your library. As a matter of fact, let me see. Yeah, I see your name that popped up right here. You have an iCloud account, right? Yeah. So it says 82 on my end. It says 81.5, Abby, on my side, or 81.6. So I don't know how accurate it is. You know what I mean? But yeah, once you guys sign up for it, first of all, you signed up for it. I want you to fact check me. I want you to go in there and be like, yo, exactly what I just showed you is what you see. This is awesome. Thank you. I love to learn. Is it Wom Wom? Did I say that right? Wom Wom. I appreciate you. Bobby said just signed up for it. Shout out to you, Bobby. I appreciate you. And here's another thing, too, is that you guys are helping architect this review. Like, trust me, I have a whole list of content that people are like, hey, can you do this? Can you do this? Like pediatrics and safety. Trust me, I have a whole list. I'm only one person. So trust me, the biggest and the most important thing right now is to get out the review. the 7-day review, right? So that is the most important thing. Once I do that, then I'm going to be pumping out content left and right. It should be every 2 weeks to a month. What do you think you were doing wrong when you failed the NCLEX? There was a lot of things that I'm doing wrong. What time will you be here tomorrow? It'll be same time, 5:30. Same time tomorrow, 5:30. So, Abby, there was a lot. I didn't take accountability. I didn't have any good time management. I had ineffective studying. Do you teach ACLS or PALS? I taught ACLS. I don't teach them anymore, but I taught ACLS when I was active duty. But the biggest thing is I didn't have accountability. I didn't know how to study. I didn't know what to study. I didn't know where to begin. So, and honestly, I was just trying to figure out on my own because, when you're in nursing school, once everybody graduates, your other classmates don't really give a fuck about you. And then number two, your instructors really don't give a fuck about you. Like, it's a very rare occurrence to find your instructor. They'll reply to you or try to give you some type of advice versus just trying to be rude or disrespectful to you. But luckily for me, I ended up, by the grace of God, opening up the clouds and shining light on the both of us, I ended up getting a mentor, and he guided me in the right direction, right? You're speaking truth. I'm trying to tell you. That's what I'm saying. That's what makes it relatable. That's what makes me relatable. That's what makes my course relatable, is because here I am, right? I don't know anybody else that actively and boastfully talks about how they were unsuccessful at that exam to turn around to be like, look, I want to give it back to y'all because I wish I would have known or had something like this when I was in school. I wish I would have known or had something like this, but when I was in school, but I didn't. Nursing school is a lot. They just throw information at you and it's horrible. It really is. It really is. Because honestly, Abby, that is to weed people out. It's to see how serious you are. What it says, is it Sundayland? Did I say that right? Just got it. This was the first time I've been here, and this is awesome. Thank you. I am glad that you are here. Monet just purchased mine. Shout out to you, Monet. Why does the NCLEX refer to patients as clients? Because they treat it as if it's a business. I don't ever refer to, like, when I'm talking to a patient, I don't ever be like, hey, you're my client. Let me tell you something right now. Nobody in a hospital calls them clients. Nobody. They're all patients. Can I buy from Australia 7? Absolutely. You sure can. You sure can. So all you got to do is just go up here to the link in my bio or go to my bio, right? And then hit that link, 7-day NCLEX course. It's online. It's online and it's an on-demand course. So it's for everybody. It says, yeah, so we already answered that. It says, I need one-on-one coaching. Ma'am, if you need one-on-one coaching, that link is in my bio. Once you click the link, it'll be the second one down. It'll say NCLEX coaching or NCLEX one-on-one coaching. If that's what you want, it's there for you. It says, did you have to take ATI predictor to see your probability of passing NCLEX? Abby, when I was in school, we did HESI, the HESI exits. I thought that HESI was terrible. And most of the reason is because in school, they make their own tests. So that's what we study for. And then they give you an exit, which you don't know how to study for because they're not school, they're NCLEX style, but you haven't been practicing NCLEX style. You know what I mean? And so when it came, they were like, hey, you guys need to study for that HESI. And I'm just like, dude, how the fuck do we even do that? And they just throw you away. And then when you fail, they're just like, oh, well, you need to look at this. And I'm just like, that doesn't help me, bro. Like, you're not giving me any context. You're not giving me any clarity. So it says, how do I access it now? So you should get an email, a thank you email, or right after you purchase, it should take you to a login page where it says congratulations on purchasing the course. And then it says hit login. So if you don't get that, I'll be able to send those out. Okay. Thank you for everything. Have a great night. Abby, you're welcome. It says, Amari says, I'm sorry, I missed what you said about the HESI test. Okay. So what I said about the HESI test is that they didn't prepare you to take HESI. They only prepare you to take the school exams. Right. And then when they're just like, hey, take this exit HESI, you're just like, well, where do I even start? But then when I went to school 5 years ago, I think it's changed up a lot to where they integrate the curriculum into taking HESIs, which in my opinion, they should be taking NCLEX style HESIs or NCLEX style types of question tests from the beginning of school. That's how it should be. Instead of just being like institutional tests because it's easier on the institute. You know what I mean? It says, I've been using your best grade. I used that when I was in school. I used it when I was in school. It says, I'm sorry what I missed. Joanna, I missed it, but hello. Joanna, what's up? You already know that these are going to be up on YouTube after the fact. It says, I'm still lost here. I'm getting is a message from Linktree telling me to plan to buy. So I don't know. Okay, so here, go to this website then. It's thebootnurse.com/special. Okay, thebootnurse.com/special. As a matter of fact, I'm going to show you guys what it looks like. That way you guys can see it. How is it? How is it now? Christy, how is what now? To study for the NCLEX. I purchased it, but I am totally lost. Prepare for the NCLEX out the gate. Yeah, exactly. Like I would want to prepare for the NCLEX right out the gate, and by prepare for it, I mean, at least become familiar with the process, the questions, and all that other good jazz. All right. Hold on a second, y'all. I'm going to try to show y'all something. All right. It says I purchased it, but I am totally lost. So how are you lost? Like, are you inside of the program? So check also, y'all, if you purchased it, check your email. Check your email. You should get a thank you email. Okay. If not, then for everybody that purchased, I will double check on my end and I will make sure that you guys get those emails. I will make sure I will email you guys personally and be like, hey, here's the login. Here's the website. This is how you get there. But it should take you directly there and you should get an email and it should say log in or it said, thank you for your purchase, log in, so on and so forth. OK, let me know. Let me know. I will stay on this live until we get that taken care of. OK, because I don't want anybody feeling lost. Also, y'all got me to 82,000 likes, so you already know what the deal is. I'm going to be on here tomorrow. We're going to do the same thing. I love that my school included an NCLEX review course into our graduation package. We have to pass. So here's the thing. I wonder what they gave you. Did they give you Hearst? Because there's some people that they'll get those and they'll just be like, they don't work for them. And that's okay. I'll give you an example. UWorld didn't work for me. Didn't work. What ended up working for me was Kaplan and Mark Klimick. UWorld didn't work for me. Board Vitals didn't work. Saunders didn't work. Hearst didn't work. All those things. So it says, so the boot nurse, what please? Can you repeat for me? The boot nurse. So it's thebootnurse.com/special. Did Hearst and it was hard as hell. Yeah. So I couldn't do Hearst because her accent is thick as hell and it was a distraction for me. I mean it, seriously, I couldn't do it. I'm just like, why is this not working for me? And it's because she's like, all right, y'all, that's right. Hypo tension. That's right. And that's no shade on her. I mean, she's from Mississippi, y'all, but I just couldn't do it. It says, does the material for the 7? No, it does not expire. It does not expire. It's an on-demand course. It says it on the website that is on demand. It does not expire. What's going to expire is that website page because it's going from $48 to $97, right? We had the same woman. Oh, you had her? Hey, so here, there's no shade on Marlene Hurst. That's her. She's been doing her thing for a very long time, but it's just the accent. Got access. We'll be doing tomorrow. Also shared with my cohort. See you tomorrow. Sundayland. Thank you. I appreciate you. I'm from Mississippi and I can't do Hearst. I missed every. Hey, their stuff is hard. Okay, the page is open. Please, where do I go? Hold on one second, y'all. Hold on one second. Let me see where you are. So once you go to your page, it should take you to a login page. So you had to do your email, right? You had to do your email, your username, and your password, right? And so you should get an email that says congratulations, right? And then once you get that email, right, to log in, put your email, your username, and it should get you on there, okay? It says not supposed to take the NCLEX until next August. When should I buy? You should buy it now. Get it for $48 and get it now. Even though you're not going to take it till next August. And here's the thing, Kat, is by the time you take it next August, it's going to have way more than what it has right now. It's going to have way more than what it has right now. Okay? I promise you that. So, hey, what's up? What other questions do you guys have? Hey, we went over NCLEX questions. Y'all know how we do. We do NCLEX questions the very first thing, right? Did that for about an hour and a half. Had a lot of good feedback. Okay? Also, we talked about the 7-day NCLEX course. It says... way more what I just joined. All right, big dog. So is a 7-day NCLEX course enough to pass the NCLEX on the first time? I've had people that literally were in here earlier that took it on their first time and it was enough for them, right? There's a new generation NCLEX review where I go over 100 questions that's in there right now that people have already told me was super helpful for them. All right. There's tons of content that's in there. that right now there's about 55 videos. I'm projected to put another 100 content videos in there on top of the actual 7-day review. But there's a new generation NCLEX review in there that is just as great. So y'all are going to be getting a ton of stuff upcoming. Okay. Way more what? Yeah, Big Dog. I was talking about way more content, right? So there's going to be way more content, for Kat if she decides to purchase it right now for $48 versus if she waited until next August, because next August may not. I can guarantee you it won't be $48. All right. I can guarantee you it will not be $48. But what other questions you guys have? Of course, just like I said, a little bit about me. I've been in the Navy for 16 years. Oh, okay. I took my NCLEX in September. I took and passed the NCLEX in September. 60% were SATA. Yep. 60 to 70% of your exam are going to be multiple choice or select all that apply. Right. And then the other 30 to 40% are going to be the case studies to incorporate, those different type of question types like extended select all that apply, extended multiple choice, the bow tie, the fill in the blanks, still the dosage calculations, all those good things. Sorry, I am stressing you. Been trying to input my mail, but all this says is that it was incorrect. Hold on 1 second for me. Let me see. Beatrice. Let's see. Beatrice. There you go. I see you right here. So let's see. Let us see right now. Hold on. Let's see. Beatrice, I got you. Don't you worry. I got you. Okay. Don't you worry. Let's see. So what I'll do. So Beatrice, yours is you have an iCloud account, right, Beatrice? I just want to make sure. It says, I didn't have any dosage, got the max amount of questions. Hey, the second time I took the NCLEX, I got 265 questions. So I understand what that's like. I'm definitely going to get the course because it helped me currently on my exam and clinical. Shout out to you, Kat. I'm glad it helped. Sorry no, you're not a bother. Okay, I see it right here. So what I'm going to do is I see your email. I'm going to send you, I'm sending the password, right? It has your login information. So you should have got that email you should be getting it right now. I just sent it to you. So if you get it, let me know. Okay. It says, can you explain one more time? I missed it. What's included in the crash course? So right now, what I'm going to do, I'm going to turn this thing around. All right. So that way you guys don't have to look at this hideous face that I have going on. All right. Give me 1 second. That way you guys can see. Okay. I'm going to turn this around. Well, first off, let me take off Beatrice's stuff here because y'all don't need to be looking at her information, you nosies. Here we go. So this is the actual website. Okay. I just versioned how can I log in from Australia? Sapna, give me 1 second. Okay. I'm going to, so you should get an email showing for you to log in. Okay. If you don't get that email, you actually you also should get taken to a thank you page. And that says, thank you for purchasing. Congratulations. Now you can log in. So if you didn't get that page, I'll check that. I'll check that out for you. Okay. So here we go. Here's what's inside of the course, right? So real quick, it's a course, it's online and it's on demand, okay? So you guys can do this as much as you want. It is for RNs and it is for LPNs, okay? Also, it is for $48, $48, y'all, right there, okay? And it will expire on this day, the 23rd at 11:59 p.m. So that is what this correlates to, meaning the pre-launch is over, all right? And so we talk about the mindset, we talk about the NCLEX structure, we talk about critical thinking, we talk about farm, management of care, we talk about physiological adaptation, we talk about the new generation NCLEX, we talk about other aspects that are in there, okay? And so once you get this course, it is yours, like forever, okay? Like it is not on a subscription or anything like that, okay? And then right here, this is what's going to come, and this is what the review is going to consist of. All right. You get day one, management of care. Right. I think I've changed the password now. Where do I go? It should take you to the login page, Beatrice. OK, it should automatically take you to the login page. All right. Yeah. So we go over farm, physiological adaptation. And here's the reason why it's broken up over 7 days, y'all, is because if you go to any other review, like we'll say Hearst or Kaplan or whatever, and it's a live review, they only do it over a 3-day period, right? And you're cramming all of this information into your head over a weekend, Like, think about how you're going to be able to retain that. But what I'm asking on an on-demand type of thing is give me 2 to 3 hours on this day. Whoops. Give me 2 to 3 hours on this day, and we'll look over management of care. Next day, give me 2 to 3 hours. And let's look at it. Let's look at pharmacology. 2 to 3 hours. And let's look at physiological adaptation. You want to know why these are the top 3? Is because these 3 make up almost half of the entire exam. Okay. And then we talk about reduction in risk potential, safety, health promotions and maintenance, basic care and comfort, psychosocial integrity. And then we talk about what's on NCLEX day. And then, of course, at the end, we have another one, which is the path to conquer the NCLEX. Okay. Also, you get all of this content that's going to be added. Pharmacology, there's 18 videos in there. 18 pharmacology videos inside of the NCLEX course. Okay. And then also I talk about, what's included. You get all this stuff that's in here. I'm about to show you guys what it looks like. I spent $3,000 so you guys didn't have to, because I failed the exam so many times, y'all. You also get access to a Facebook group, right? Also, there's me when I was working at the burn center. That was when I worked at the burn ICU. Okay. And it was a great spot. One of my first places I ever worked as a nurse, or the first place I ever worked with as a nurse. And it was awesome. I loved it. The crew there was great. The management was great. It was awesome. And then also a couple of testimonies, right? You guys can check these out on YouTube as well. All right. I also had a young lady last week or the week before pass her NCLEX, and now she's an LPN about to go out there and take care of babies. You know what I'm saying? And then also, like, hey, who is it for? We're uploading stuff. Can you do all this on YouTube? You sure can. But, why go to a one-stop shop or do a one-stop shop? In my opinion, also, you get 7 days. You get 7 days to take it. All right. Or 7 days to use it. If you don't like it, then hey, then you get your money back. Also, now here we go. Here is what consists inside. It says, when will this be available at this price again? I don't get paid until the 3rd. Buttercup Reese's. So it's available right now for $48, and it's going away on the 23rd. So I'm sorry, on the 24th, which is Friday, it won't be there. It's going to go up to $97. Okay. It says, thank you. I'm going to buy it. I'm going to buy it soon today. All right. Shout out to you. So I'm going to show you guys what is in here. All right. So this is where we're talking about cardiovascular meds. It says, this is awesome. And thank you so much. About to start trying my library or trying my library together. Have a good night. Okay, Monet, shout out to you. You have a good night. Today is Monday. I kept thinking today was Friday for some reason, but But hey, we talk about the computer adaptive test and how it's graded, the passing standard, the NCLEX test plan, which was updated on April 1st of this year, the rules, and here's the biggest thing right here. This right here, all 8 of these, that's almost 4 hours of content, y'all, that are broken up into almost 30-minute videos, right? Or they're less than 30 minutes, right? And we go over questions together. At the beginning, we talk about the new question types. We talk about what's in there, the content. We talk about, the test structure, and then we jump right into questions. We talk about the topic, right? What is the topic of this question? By understanding the topic, you can kind of paint the picture of what's the next direction that you go based off of what the question is asking us, right? Based off of what the question is asking. And as it starts to go along, we talk about which ones are incorrect, and we talk about why they are incorrect. Why is because when you are reading your questions after you answer them and you're going through the rationales, that is what solidifies that knowledge inside of your head. Okay. And so we go on and on and on. Right. And then here's another one where we put it in order. We put them in order. Right. And then I'm going to show you guys one more. Let me see if I can find it. Oh, I know it's on here somewhere, but let's go to number 2. Nope, it's not in there. Or maybe it is in here. Oh, here we go. Here we go. Hold on. Don't go nowheres. Don't go nowheres. All right, here we go. Whoop. All right. Oh, I missed it. Let's go back some. All right, y'all. That right there, case study, right? We go over case studies, right? The findings, right? Talk about the general opponent. We talk about the general impression of the patient. You get all of your vital signs, the health and history, all that good jazz. And then we jump into the items. So you'll get 6 questions per case study. 6, right? So it's telling us right here, my topic based off of what we were reading out of our case study, the topic would be COPD, right? And then you guys will see pauses pop up like this. That is your indicator to pause the video. And pause the video and work out the question on your own. And then we jump into the question and we go over why that's incorrect. Then we go over why the next one's incorrect. And then we go over why the next one's incorrect. And then eventually we get the right answer and we talk about why it is the right answer. We do that for every single question. Okay. And then you guys will start to see, here's your select all that apply ones, right? Those are still the same. And then let's show you, that's our, essentially our close, our fill in the blank type, right? Fill in the blank type right there. So you guys will start to see these pop around too, right? Because they're a part of your NCLEX. And you'll see them a part of your case study. And we'll talk about which one's right and which one's wrong, right? So talk about air trapping, right? Because you're talking about COPD. If you understand the pathophysiology and the disease process of COPD, you'll understand what air trapping is. This is why it's important that you understand your content, right? And then even this one, so important, right? I want for you to tell me what is anticipated. What type of prescription is the doctor going to write? What kind of prescription am I going to anticipate the doctor is going to write for a patient that has COPD based off of that, right? So is it anticipated or not anticipated, right? You'll see it pop up again. This is absolutely amazing. Lioness Beauty, I appreciate that. You'll see it pop up again, right? And then I'll tell you why. You'll hear me we'll go through the rationale together. I say we do everything together because we do it together, right? Talk about why. We're going to use antibiotics, You use glucocorticoids, and then we're going to use IV bolus and all that other, or not IV bolus, but y'all understand what I'm saying, right? And so go through what's indicated and what's not indicated, for a client who begins having difficulty breathing. What am I going to think about for a patient that has COPD, right? What's up, Landy? How are you? Hey, we're going over the 7-day NCLEX review, the 7-day NCLEX course, which is my course for $48, showing everybody what it looks like on the inside, right? And here's another one. COPD, that's our topic, right? And then we talk about our questions, right? And then we answer them like so. You will always, in between every question, you will see this pause. You will see it. You will see it in between every question because that gives you time to actually go through and answer them, right? That's why I put it there, right? And then here's some other ones, our regular multiple choice. And some other ones, so on and so forth, right? I'm looking for my one that has bow ties. That way, here we go. Here's our bow tie, right? So we can go back. Let's go back. All right. So there's our case study right there. Our case study, right? Question 86. I read the case study out. We talk about the vital signs that are given at that specific time. And then we go to the question, right? And it's a bow tie. So it's like the very first thing that I'm going to want to know is what condition is the patient likely experiencing? You're waiting on the confirmation email. Okay. I appreciate you. Is it Tiana? I appreciate you. You guys should be getting that confirmation email. Okay. Also, so we'll talk about the condition and then we talk about the actions to take based off of the condition that we pick. Right. And then we talk about the parameters that we need to monitor as a nurse. Okay. And so there's one bow tie. We have a couple of, I think I have another one in here. Let me see if I can find it. Right there it is. And so here's another one where it's talking about a client most likely experiencing. Okay. So this one's talking about our topic that we determined was cirrhosis of the liver, right? Cirrhosis of the liver based off of our case study. All right. So we're thinking about cirrhosis of the liver. This is how I want you guys to think about the questions. It's like, man, what topic is it? What is it asking me? User 57. What's up, girl? I see you. I know you had said something earlier. I don't know if I had said hi to you, but what's up? So this is in part 7, y'all. Hey, and these videos are no longer than 30 minutes. Why? Because I'm an instructor. I'm a teacher. I'm an educator. I've been an educator in January 9th. It'll be 8 years. And I can tell you right now, even me sitting up there teaching for an hour is exhausting. So why would I want to do it to y'all? Y'all sit there, get small little spurts in when you can, right? Hey, for the review, all I'm asking is for 2 to 3 hours a day for you to get this in. Do 30 minutes and then go to the bathroom. Come back, do another 30 minutes and go back to the bathroom. You know what I'm saying? Or go get a snack or go do something. Every 30 minutes. It's just like absorbing your content, right? Just like absorbing your content. And we go through, hey, we have some dosage calculations. Hey, don't think I wasn't going to add it up in here. Don't think I wasn't going to add it up in here. But then also, look, y'all see that? We got equations out up in there. You know what I'm saying? Got the equations up in there. I got y'all. Y'all know what the deal is, right? And then we come up in here. We have some more select all that applies. And then we have another case study right here. towards the end. Hey, 90. Hey, there are 100 questions in here, y'all. 100 questions. All right. Expected versus not expected. Right? These are the things. These are the things that you will get. Okay. Also, look at this, y'all. Let me show y'all over here on the left side. I even have a section I call the NCLEX Content Vault. You get tons of content. Tons. Look right here. Pharmacology. There are 19 or 18 pharmacology videos in here. Talk about how to study pharm, dosage calculation, and then all the important medication that you would see, right? On NCLEX, right? And trust me, I have a whole bunch more that I'm going to be putting up in here. Like when I tell you I'm going to be churning them out, we're going to have over 150 videos in here. Hey, and once you buy it, right now, you get it forever. You get it forever. All right. Hey, but what's up, y'all? Hey, another thing. People were asking me to make shirts with my little sayings on there. So it says, question, do you have an app or is it just a site? No, you can actually do it on your phone. It's through the Kajabi app. So there's actually a way, I'm not sure on your end, but you can actually download it. It's Kajabi. Here, let me see if I can show you. So if you go to Kajabi, it'll show you you can download the app. So the app for everybody that bought it, it's Kajabi. And I'm going to turn this thing around so you guys can see it. Let me see. Let me turn this around so y'all can see. There we go. So I'm going to turn this around so you guys can see. For anybody that bought the course, this is the app this is the program that I use where I have my course instilled. So if you have an iPhone or of course you have an Android, it's the Kajabi app, right? And it looks exactly like the login. Like it'll look like everything. I can AirPlay. You sure can. That's exactly what I mean, right? When I was studying for NCLEX, I did the same thing with Mark Klimick, or I did the same thing with Kaplan when I used them. I turned them on when Kaplan did have an app. I don't think they have an app anymore, but I would turn it on. I would connect it Bluetooth to my truck, and then I would drive 30 minutes to work. So I would be able to get at least 1 to 2 pieces of content videos in while I was driving. It's essentially think of it as listening to a podcast. Think of it as listening to a podcast. Okay. So anybody that bought the course right now or has bought the course in the past, this is the app that you guys can use and it'll take you in there. So anything that you have bought, anything that you bought from me, if it's coaching or if it's the 7-day NCLEX course or anything like that, all of that will pop up inside of Kajabi. I put it on my big TV. I can find, won't fall asleep. Hey, you can do that too. I mean, I don't know if you want to put me on a big old TV and be like, oh my God, Kevin, you have a big forehead. I'm like, la, 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 la. Okay. I know we're a little shiny out here. We're a little shiny, but hey, what's up, everybody? Hey, what other questions do you guys have? Hey, I usually do these 3 times a week, but everybody was doing such a great job today. I was like, you know what? Y'all want to do it every day? Everybody's like, let's do it every day. So I'll be here tomorrow, 5:30, doing it at the same exact time, coming over here, giving y'all some knowledge. Also, at everybody's request, they want shirts. So I'm going to make some shirts with my little sayings on them. And I missed the app part. Please repeat. So you can go to the Kajabi app. It's Kajabi. And it has like a blue outline and it has like it's a blue background with a white. It looks like a K. There's like 2 triangles, but it looks like a K. So that's the app that you can download that will get you into the course so you can take it on the go with you. Okay. So, but yeah, at the request of everybody else, they want shirts. So I guess I'll make shirts. Hey, also, if I made an ebook, would anybody want it? If I made an ebook, would anybody want it? With like real pertinent things that you need to know, for all my readers that are out there. You would want it? Okay. All right. Well, I got one. I've actually been making one. I got Farm tomorrow, 5 to 7. I'm going to miss it tomorrow. Yes, ebook. Okay. Well, I'm going to show you guys something right now. I'm going to show you something that's exclusive. I haven't shown anybody this yet. Let me find it. Let me find it. Kevin, get your life together, bro. Where is it? Here we go. And here we go. All right, y'all. Here we go. Oh, it won't let me do it. That's dumb. Hold on a second. So I'm going to find it for y'all. I'm going to find it. Hey, so what other questions do you guys have? What other questions do you guys have for me? What other questions do you guys have for me? Let me see what we got. Where to buy the course. So Kate, if you want to go up to the link in my bio and click on the link in my bio, it's a link tree and it'll take you to all the links that I have. It'll say 7-day NCLEX course and it'll say NCLEX one-on-one coaching. The first one, the 7-day NCLEX course, that's the one for $48. And that's the one that's expiring here soon within the next couple of days. All right. So what I wanted to do is show you guys essentially the cover page. As a matter of fact, no, I got y'all. Hold on a second. Hold up. Hold the phone, baby. I got y'all. Here we go. Here we go. Here we go. Let's see. Here we go. See if it'll let me do it. Probably won't let me do it. That's okay. All right, here we go. Let's see. Let's see if you guys can see this. All right. What do you guys think about that? I call it the NCLEX victory guide, right? And of course, you guys already know what the saying is. The path to conquering the NCLEX begins with you. Remember, because it is all about you. Remember, it's what you do and what you don't do in order for you to conquer anything. But we're talking about the NCLEX, right? We're talking about the NCLEX. You like the name? Hey, I appreciate that. I kind of had to go back and forth to kind of get that. But hey, so this is what it looks like. Hey, right now, this guide is dense. What it said, Kajabi is taking too long with code on his bio. It's taking too long. Is the code not working? Is the code not working on Kajabi? It should. Oh, I'm sorry. Is the code not working on my bio? Because it should be working. What I'll do is tomorrow when I do the live, I'm just going to put it inside of, if it lets me put it inside the bio, like down here. So, but yeah, so this is what it looks like, y'all. This is the guide. The guide is coming soon. It's coming soon, like this week. So it's coming soon. You got, hey, I just wanted to get a good census of it, but it'll be there if you want it. And, we hit a bunch of pertinent things that are in there, something, doesn't have to be super crazy, but there's some pertinent things that'll be in there for y'all. Okay. But what other questions do you guys have? The Kajabi is taking, and you can also, 5-7, you could usually, you can log in online too. You don't have to get the app. You can log in online as well, like just do the regular online through your phone, and you can do it that way. Okay. So, but y'all got me to 80,000 likes. I appreciate y'all. I know there's a bunch of people that said that they had issues with getting on to the course. So we're about to find out and see what's going on with that. Shouldn't be any more issues though. And I'll send out those passwords for people that need them. So what other questions do you guys have? Hey, if you guys are new here, we did NCLEX questions. We usually do them starting right around 5:30. Once we get 100 people inside of the live, it's on and popping. So if you guys are new here and you haven't done, any of those, like liked, shared, follow, hey, I do NCLEX questions 3 times a week, but now we're going to be moving to every day, right? We're going to move to every day. We're going to do it every day, 5:30 to we're at least going to get a good hour and a half of questions, right? We're going to do at least a good hour and a half of questions, right? So I think that, that would actually really suffice to help people out. What y'all think? Right? And also, if you are new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse and you've been hanging out here listening to me run my mouth, like, what do you do? What do you do? A little bit about me. Been a nurse for 3.5 years. I've worked in the ICU, I've worked in the OR, and I worked in PACU. I liked the PACU. I thought PACU was great. I've been in the Navy, the U.S. Navy, for 16 years on the downward slope on the way out the door. I am a surgical tech in the Navy as well as a master instructor. So I've been teaching for the last 8 years. I taught in a surgical technology program. I taught in a combat casualty program, teaching, officers how to do combat casualty as well as, other medics, Army medics, Air Force medics, and hospital corpsmen. I was an ACLS instructor. Currently, I'm a trauma nurse instructor as well. So I have a pretty good background in regards to teaching. It's another reason why I decided to do TikTok lives to bring all this information to you guys, because I love teaching. And to answer anybody else's question, yes, I 100% have tried to go work at other, institutions of higher learning, but I never got phone calls back. So I kind of took it upon myself to come on here and start teaching. And I find this a lot better. So it says, I'm from Alberta. So Alberta, Canada. Okay. Done with nursing from India in 2014. Now I'm going to take the NCLEX. Okay. Shout out to you. Baton Rouge, first semester PM program. We appreciate you, ma'am. I appreciate you for being here. And I also appreciate you sharing with everybody in your cohort, right? Just, hey, I do this every day. And here's the one thing I do want to let everybody know is that it doesn't matter if you're taking the RN or the PN, the content is relatively all the same. As a matter of fact, it's all the same. The only thing that's different is as an LPN, you need to know what you can and can't do, what you can and can't accept. That's the biggest thing, right? Like, that you can do sterile procedures, but you can't do first assessments. Like, you can do IM medications, but you can't do IV push meds. Like, that, you can do wound care changes, but you can't do blood transfusions. You know what I'm saying? So it doesn't matter what your state says. It's because the NCLEX is a national standard. It doesn't matter what your state says. And that's another thing I had to keep going back and forth with on people. But, yeah, that's why when I have the 7-day NCLEX course, it's for both RN and LPN. Now, I have some stuff, loaded up, getting ready to get taken care of. So because somebody was like, hey, can you make a specific LPN one? And I have that one in the works as well, of creating an NCLEX course or an NCLEX review strictly for LPNs. So that one is in the works as well. But for now, I've had LPNs use my program, and they were just like, it's great because the content is still the same. So what else do you guys got? I think I might hang out here for another 5 or 10 minutes to essentially kind of just answer any questions, that anybody else has had. Also, I do have merch right now, but they're not like my cool little sayings that I say on the lives. But if you guys are looking to support, you guys can go check that link out, which is also in my bio, and just click the one that says merch, and it'll take you directly there. If you guys want to support me, or if you guys just want to look cool in a nice shirt, this shirt won't be on there. This one was a prototype. So, but yeah, this shirt won't be on there, but there are other things that are on there, and I have other merch that's going to be going up there as well. So what other questions do you guys have? Shay, thank you for the share. I appreciate you. Yeah, we had like 800 or 900 people that were in here earlier. So shout out to everybody that was a part of that for sure. So what other questions do you guys have? Hey, if you guys are new here, we did NCLEX questions. We got those off nurseslabs.com. They're free sets of questions. You guys can go over there and check them out all you want. They are free. Okay. So, and I do this, we go back and forth and, kind of break them down and make sure everybody understands. So essentially it's like going to class, but this is a class you want to come to rather than going to your actual formal class that you had to pay for. So, but yeah, what else do you guys got? What else do you guys got? It says, y'all have a good night. Heading back to the books. Yes, ma'am. Go get those books. Get that degree, get that license. In that order, because that's kind of how that order works. You can't get one before the other. So good luck to you. I know you're going to do great. Go get your study on. So, but all right. We got 34 people in here. You're welcome. Is it Quant or Quante? Did I say it right? Quant 83. You are, ma'am. You are very welcome. You are very, very welcome. Like I said, I do these Monday, Wednesday, and Friday, but your boy's going to be back here tomorrow doing NCLEX questions. At the request of all the people that smashed that like button. You already going to know what I'm going to want tomorrow. I want 85,000 likes tomorrow. 85,000 likes. You know what I'm saying? We got to make that happen. Make sure you guys share it to everybody, right? Share it to the people that are in your cohort, right? Share it to the people that, if you're a first nursing student, like first year nursing student, or even pre-nursing, share it to people that you're in class with. You know what I'm saying? If you're about to graduate, share it to people you're in class with. You know what I'm saying? Don't be selfish. I'll be here. You'll be here. Hey, I hope you are here. It says Hero Link. Howdy. How are you? But yeah, share it. Like liking, sharing, and following. That's what I need. Because the reason why I need it is because TikTok wants that. Because the more that y'all like and that y'all share, the more that TikTok is just like, oh, some shit's really popping over at his live. Let's get it in front of people, right? So we're great. You all, hey, I'm Gucci around here. I'm Gucci. Had a good day. Got 80,000 plus likes. Had a lot of engagement. We had a whole bunch of knowledge that we gave out. So I had like about 4 or 5 people come into the live and tell me that they passed their NCLEX exam. Or they passed their tests. Like, I'm happy. I'm happy. When I'm happy, or when they all are happy, I'm happy, because that's telling me that I'm doing something right for y'all in some way, shape, or form, no matter how small. Like, I make impact, right? That's what it's about. Make an impact. So when you guys get out there and you guys start working as nurses, make an impact on somebody. One of the things, and I'm going to start mentioning this tomorrow, is when you get your NCLEX and you start working as a nurse and you get proficient, don't you ever in your life be rude or disrespectful ever to a student. I need for you to always realize that you remember where you came from and you understand the position that they are in because you used to be in it. All right. Never be too good to teach anybody, period, ever. Because you remember what it was like being in school and they were just like, I don't want a student. Doesn't matter what the fuck you want. Doesn't matter. We love nursing and medical staff. They play a vital role with our product. Shout out to y'all. So here's the thing, y'all. Me as a nurse, I love precepting. I've been a preceptor. I tried to be a preceptor literally day one of me working on the floor, and they were like, no, you got to work here for at least a year before you can do that. I'm like, all right, cool. Hit my first year. And I was like, give them to me. And then I started working in the OR, and I started precepting anywhere from 2 to 3 students, to include surgical tech students, because I love teaching. That's what I like, because it's not rare, but it's just like some people are just like, I don't want students in there. And I'm just like, y'all trip me out. Y'all trip me out to not want students in there. How else are they going to learn? Because obviously you just learned because, you just learned, right? You already knew it coming right out of the womb. Like, make it make sense, right? So that is my task, my forever task to everybody. Once you pass your exam and you start getting out there working as a nurse, is to take a nursing student under your wing and guide them. That is mandatory. That is a mandatory thing that I drop to everybody. Make sure that happens. Okay. So, but yeah, what else do you guys got? What other question you got? Hey, so, quick things is, if you guys don't follow me on Instagram, go over there and follow me at The Boot Nurse. If you guys don't follow me on YouTube, all these videos, all these lives that I do go up on YouTube, right? So if you miss them, they'll be up there for you. All right. So that is also The Boot Nurse. You can go follow me on Twitter, or you can go follow me on Thread. I don't ever use them because number one, I get no traction over there. Number two, I don't even like being spread thin like that. It's annoying. So, but I like most places I'll be is on TikTok and Instagram for sure. More TikTok than anything, because this is where I got the most folks at. So, I cater to y'all the most. Also, anybody looking for one-on-one coaching, because listen, I understand what it was like to not know the direction of which I was going. I failed my exam, my NCLEX, my nursing exam 3 times to get a license, 3. And then it finally took a mentor grabbing me and telling me in very explicit words that I wasn't doing something right. We're no longer doing it my way, because my way doesn't work. We're going to do it his way. And his way is the way that I adopted. And now when I teach people, that is exactly what it is. It was just like, nope, we're not doing it your way. We're going to do it my way, because I know that this way works, because it's the way that I adopted from somebody telling me that this is the way that it works. My mentor was a 20-year ICU nurse, been on multiple deployments, a retired Army guy, very much spoke the language of what we need to do in regards of nursing graduates to conquer that exam. All right. And that's what I bring to the coaching. You get one-on-one private sessions with me, AKA just like this, but it's private. It's not, upwards of 1,000 people. So you get that. We break down NCLEX style questions together. We go through a study calendar with you. Like, we create one together. We also create a tracker so we can see your trends and where you need to focus on. You get mentorship, like we start talking about, what to look out for when you guys are going out there. Like, all the stuff that I tell you guys now, but it's more in depth when it's one-on-one. You get the unlimited motivation, like the motivation that I give you here, but you got it all up in your face, right? It's to where you're just like, oh, it's overwhelming. You know what I mean? And then you also get my phone number. I check your tracker twice a day. I text you throughout the day. You have any questions about anything? We make stuff happen, right? So if you're looking for one-on-one coaching, that link is in my bio up here. Go up there, hit my bio. It'll hit the link, and then it'll say 7-day. It'll say NCLEX one-on-one coaching, right? And that's what you get. It says what's included in the 48-day package, or is this something different? This is something different. This is one-on-one coaching. So if you want one-on-one coaching with me, that is the NCLEX one-on-one coaching, which is in my bio. The $48 package comes with you have a lifetime access to the course. Right now it has 55 videos that are in there, which includes tons of content, as well as it has a new generation NCLEX review in there. There's 8 videos. Each video is about half an hour long. And if I did that math right, that's around 4 hours of content right there just for a review, where I break down NCLEX style questions and stuff like that. You get it for $48. Once you get it, it is yours forever. It does not go away, but that price is going away. So it won't be there Friday. It will be gone on Friday. Trust and believe me. Okay. Because it's going up to $97. It's going up to $97. Okay. So that's what that's for. And we go through, and you get every video, you get every content video as it's uploaded. It's 48 USD. Yes, it's 48 USD. I don't know what that is. I don't know what that the currency conversion to the Canadian dollar is, or whatever else. I'm not sure. But yes, $48. 1-4 and then 1-8. So 4 and then 8. So but yeah. So got the NCLEX course that's there. You got the one-on-one coaching. You got the merch. All that stuff is linked in the bio. So pretty sure I missed it. Misha, you did. You are about an hour. It's almost 8 here. So 1 hour, 2.5 hours late. You're about 2.5 hours late. Around 80. Around 80 what? What'd I miss? 80 what? 80 Canadian dollars? Is that how it works? That can't be it, really. So, but yeah, what other question you guys have? I got another 2 minutes that I'm hanging out. Got another 2 minutes. Also, I made an ebook. And that's going to be out this week as well. So anybody interested in an ebook, that'll be placed on there as well for anybody that wants that, for sure. So Canadian SD. Okay, Canadian is 65. Gotcha. All right. But yeah. So hey, just a little bit of a recap. Hey, 5:30 Central Standard Time, Texas time. Unless you're in El Paso, because they're in Mountain Time. But yeah, it's 5:30. I got 83,000 likes, so we're gonna be here tomorrow. We're gonna do the same thing. We're gonna do some questions tomorrow. We're gonna start at 5:30. Usually takes about 5 minutes before we get a little over 100 people in here, and then we will keep it on and popping, and we will turn it around, and we will most definitely get to the questions. Hey, the questions can vary. One time I did 50 questions. One time I did 75 questions. One time I did 30. So it all just depends, right? But we get about a good hour and a half of content of questions and answers that we go through. Okay. We talked about the 7-day NCLEX course. Hey, go over there and get it. It expires this Thursday. So Thanksgiving, it expires at the end of the day. So rolling into Black Friday at midnight, it's going to be gone. One-on-one coaching, that is in there. That is there as well. Merch is also there as well. So if I don't have any other questions, I hope everybody had a good weekend, a good safe weekend. We will be doing the questions again tomorrow, so make sure you guys are here prompt. Okay. And then also be kind to yourself. That's the last thing I like to end with, is be kind to yourself. You can't do anything in this world unless you're kind and you take care of yourself. You can't take care of no kids, no spouse, no nothing unless you take care of you. Okay. So always take care of yourself, love yourself. You have to. The way that this world is, ain't nobody going to love you more than you. I promise you. So keep all the negativity out, keep all the toxicity out, and keep pushing towards your goal of becoming a nurse or a PA or a doctor or whatever your goal is. out here in life. Okay. So with that being said, ladies and gentlemen, it is time for me to log off, and I will see everyone tomorrow at 5:30. Bye.